Almost ready. Okay, we are live, Senator Carson.
Thank you. Good afternoon, everyone, and welcome. I am Senator Sharon Carson from Senate District 14. Today, we will be holding a meeting of the Senate Judiciary Committee. Before we get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As the chair of the Judiciary Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12 pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that, 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided on the general court website. 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call 603-271-6931. 4, in the event the public is unable to access the meeting will be adjourned and rescheduled. 5, please note that all votes taken during this meeting shall be done by roll call vote. 6, finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will call the roll. Senator Gannon.
Senator Gannon in Sandown on the shores of beautiful Phillips Pond in sunny Sandown. In my home, I have college students back on break and they may walk through my home office.
Thank you. Senator French.
Harold French, Senator District 7, broadcasting live from the office of with Eugene Sullivan in Concord, New Hampshire. There are other people in the city, but no one in the room at this time.
Senator Khan.
Present in Keene, my home, and my wife will probably arrive sometime in the next couple hours.
Thank you. Senator Whitley.
Hi there, Senator Whitley from my home in Hopkinton. I'm alone in the room, but my family is in the house.
And Senator Carson. I am currently alone in my home in Londonderry, but my husband and daughter will be coming back shortly. So you might see some folks walking through. Okay, before we get started today, we're hearing 2 bills this afternoon. The first one that we are going to take up is Senate Bill 233. And I would like to just make a couple of announcements here. The committee work, we're going to be finished by 4 o'clock this afternoon. So what we are going to do after the sponsor of the bill introduces the bill, everyone who testifies after that is going to have 3 minutes to testify with the committee. We have over 30 people who have signed up to speak, and we want to make sure that everyone who speaks, everyone who has signed up and wishes to speak has the opportunity to do so. And we know that there will probably be people in the waiting room who would like to speak as well. So that being said, I'm going to ask everyone from the outset, please do not repeat testimony that we've already received. Please do not read written testimony. If you have written testimony, please submit it to the committee. This bill is not going to be exec today. And so the committee will have plenty of time to read your testimony. Ms. Malilo is going to be keeping the time. And when we're approaching we reach the 3-minute time, she will announce. So please pay attention to that. And so why don't we go ahead and get started? And I will open up the hearing on House Bill 233 FN and recognize the prime sponsor, Representative Ullery.
Thank you, Madam Chair, Senator Carson. For the record, I am Jordan Ullery of Hudson, New Hampshire, and the prime sponsor of HB 233. This is a relatively simple bill. All that it does, regardless of all of the hype that's going out there, is mandate that if a child is born alive, it is to be cared for. This bill seeks to prevent the horrific slaughter, such as that with Dr. Gosnell in Pennsylvania. The bill does not prevent the parent from holding their dying child. The bill does not prevent the last rites from being administered. The bill does place a burden on all present to try and save a human life. I hope the committee will see fit to examine this bill, modify it if needed. The Senate likes to do that, so that when a child is born alive, it's not just thrown on a heap of trash and left to die. That has happened elsewhere in this country, unfortunately. This is common sense legislation that makes it clear, should a child be born alive, that child is to be treated with humanity. I'd be happy to answer any questions the committee may have.
Thank you very much for your testimony, Representative Ullery. Are there any questions from the committee? Senator Gannon.
Thank you, Representative. If you'll take my question. How often has this occurred in New Hampshire, if ever?
Senator Gagnon, as you may or may not know, there are no records from any abortion clinic in the state or emergency rooms. However, I know from having been a paramedic and having worked in emergency departments in this state and in other states, that if a woman comes in and delivers a child early or late or whatever, efforts are made to save that child. I know that I have personally made efforts to save children in such circumstances.
Thank you.
Are there any further questions? Okay, seeing none. Thank you very much, Representative.
Thank you, Madam.
The chair will call Senator Birdsall.
Okay. Is she? Okay. Senator Birdsall? Okay.
Hi, my name is Senator Regina Birdsall, Senator for District 19, which encompasses the towns of Derry, Hampstead, and Windham. And I just wanted to express my support, and I'm not going to go through as Senator Carson had requested. I did forward a recommended amendment, and that amendment is, I believe, 2021-1023S. And I know that Ian Hewlett, who helped us write it, is going to be following up, and I'd rather him speak to the amendment because he has deeper knowledge of it.
Okay, thank you very much, Senator. Are there any questions for Senator Birdsall? Okay, seeing none. Thank you, Senator.
Thank you.
Next, we will call Senator Perkins Quokka.
You are all set, Senator.
Thank you very much, Chairwoman. I think I'm going to speak on 625 and save my remarks for then, but I would like to register my opposition to this bill.
Thank you very much, Senator. Okay, next we'll call Representative Marjorie Smith.
Okay. Representative Smith? Okay.
Thank you very much. And it is always a pleasure, Madam Chair, to appear before your committee. I am here representing the position of the House Judiciary Committee, which voted ITL on this bill. And I was pleased to hear Representative Ullery explain that there is no indication ever that such a thing has happened in the state of New Hampshire. And there's a very good reason for that. I have submitted testimony, and I will not repeat it now, but I hope that by the end of this hearing, you will be familiar with the neonatal resuscitation program. That is a standard, that is a condition of employment for all medical professionals in New Hampshire. It's national, but I'm just speaking about New Hampshire. There are hard things that have happened elsewhere, but they have not happened in New Hampshire. This is the report. Their standards are called the Ethics and the Care of the End of Life, and they provide explicit guidance for counseling families and for what procedures have to be followed. If in fact anyone who is a medical professional violates those standards, they would lose all their rights to practice medicine at any level in the state of New Hampshire. We already have in place what we need to make sure that if something horrific happened and someone in the state of New Hampshire were to behave in a way that they never have, as Representative Ullery said he had never seen, there are already appropriate steps in place, not for the legislature. As someone who many, many years ago was privileged to have 2 successful pregnancies and now to have 2 terrific children who are in their 50s, but they're still my children, I know that there was no room in the doctor's office for 424 legislators to make decisions. I was there, my husband was there, a doctor was there, and they are the people who should be making decisions here. This bill is one more unnecessary and inappropriate effort to interfere with the rights of women and their families.
Excuse me, Senator Carson, that's 3 minutes.
Thank
Okay,
you very
thank
much,
you.
Senator Carson.
Thank you, Representative Smith, and we'll make sure to read your written testimony. Okay, next we're going to call Representative Horrigan.
Okay.
Hello, I'm Representative Timothy Horrigan. I'm also from Durham, like the previous speaker. I'm also a member of the House Judiciary Committee, which voted to find this bill inexpedient to legislate, but there was a little bit of drama on the floor, and it ended up coming to you with actually what is actually a deceptively large majority. Not that you care, all you care about is the fact it got over here, but there was there was some extracurricular stuff around it. But this is a very, well, strictly speaking, it's probably unnecessary insofar as like no medical professional will keep their license for very long if they fail to provide medically appropriate, reasonable care. But there's often a lot of disagreement about it. And the fact of the matter is, well, I'm a man, so I've never been pregnant, of course, but I know that all pregnancies are difficult, not all of them end perfectly. A large percentage end in miscarriages or stillbirths or the birth of babies who aren't viable outside the womb. And this interferes with, is a very difficult moment in a woman's life and in her husband or partner and the family's life. And so when they have a baby who won't live, they should be allowed to, they should be allowed to mourn it. And if it's still alive, but isn't going to be able to live, to comfort it in its few moments after being born, rather than being wished off as the intention apparently is here to have extraordinary care. And this is also, of course, inconsistent with how families are allowed to make these decisions at other points in life. In the rest of life, that's something that the family can, and of course, if it's an adult, the person who's dying too, like, can make it on their own rather than. So this is a very cruel bill. And of course, like many of these bills, it criminalizes medical practice, which is risky. We have a shortage of doctors and nurses in the state anyway. If we start throwing them in jail or threatening them with prosecution, that's going to make this an even less attractive place to practice medicine. And also, something I might warn you, those will probably be resolved by the time you executives. It refers back to a couple of definitions in existing law, and I think those definitions may be changed if the majority budget, which I'm not going to vote for, but this majority budgets might pass. So they have like some extraneous amendments in the budget trailer bill, which will affect that. But so anyway, this is a bad bill, and I hope you find it any speed to legislate. And I'll also say I apologize. I was one of those who missed the vote on the House because of the extracurricular activity I referred to, but I'm here today, so hopefully my words still carry some weight, notwithstanding the mistake I made back in February. So please do not let this very bad, very cruel bill go any further. So thank you.
Thank you, Representative. Are there any questions for Representative Horrigan? Okay, seeing none. Thank you, Representative.
Oh, thank you, Madam Chair. Pleasure to be back.
Next, we're going to call Representative McBeath.
Okay. I apologize. I'm just looking.
Nope, that's okay. Oh, there she is. Thank you.
Yes, I apologize for that delay. Good afternoon, friends and colleagues. This is Becky Macbeth. I'm a state rep from Portsmouth, and I'm sit on the House Judiciary Committee. Thank you for letting me speak today. I just wanted to ask you, I'm speaking in opposition to this bill. This bill tries to fix a problem I think is not there. And I just want to remind all of you, which I know you know, that this is really a precious and very personal time for a woman giving birth and her family. And that professionally, this is for the physicians that are, delivering this child, it is a very principled time as well. So I hope that you will reject this bill and not move it forward. Thank you so much for your time.
Thank you very much, Representative. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to call Senator Hood, Senator Matthew Hood.
Okay. Maybe up top. Okay. Thank you. Senator Hood.
Hello, Madam Chair, members of the committee. Thank you for taking my testimony. For the record, my name is Matthew Hood. I am the Vice President of Government Relations at Dartmouth-Hitchcock. You will hear from several providers today concerned not only with the intrusion into the provider-patient relationship, but also the unintended consequences of these particular bills. I am not a provider. And while I understand the unique nature of the abortion discussion, frankly, we have approximately 14,000 employees who likely hold a variety of positions on the topic. I am a representative of Dartmouth-Hitchcock Health System. And as a system, we echo the concern with legislative intervention in the provider-patient relationship, particularly when such intervention criminalizes our providers. As such, I'm here to lodge and communicate our opposition to HB 233. And I would say, Madam Chair, for efficiency, you would hear the same thing with respect to HB 625, should you wish to take that now. Thank you.
No, Senator, we're going to have we'll hear from you on the next bill.
Okay.
Okay, thank you. Okay, Senator Gannon has a question, then Senator Whitley.
Senator, are you still there?
I am. Thank you. Hello, Senator.
So isn't the behavior, if they didn't help the fetus / baby now, isn't it already criminal not to help the child? So how would that be changing anything? We had earlier testimony that under the neonatal response treatment, treatment had to be given. So isn't it already criminalized if you don't help the fetus?
I guess what I would do is I'd say two things to that, Senator. One is I would defer to the clinicians who are subject to that regulation / parameter, because I'm not familiar with it. And the other thing that I would say is then it's unnecessary, right? We have provisions in law, for example, in statute, for example, with respect to exams under anesthesia, where there's not a criminal penalty attached in that section. And one could ask, well, why is that? And the answer would be because it would be a battery under criminal law. I think what becomes problematic, and again, I'll defer to our providers, is when you talk about reasonable standards and reasonable care being provided without defining what that is and then criminalizing it as a felony A, that would be problematic.
Thank you.
Senator Whitley.
Thank you, Madam Chair, and thank you, Senator Hood, for taking my question. As you're well aware, and you experience probably on a daily basis, we hear about the dramatic healthcare workforce shortages we have in New Hampshire. I'm wondering if you could tell the committee about your thoughts about the impact of a bill like this, what it would have on the healthcare workforce in New Hampshire, and in particular on OBGYN practices.
Thank you for the question, Senator. I can certainly speak writ large to the healthcare workforce challenges that exist across the state, and certainly for our system. I mean, at any given point in time, we have hundreds, if not 1,000 positions that are vacant that we need to fill. I would defer to Dr. Alana Cass, who is, I believe, signed up to speak. She's the chair of OBGYN at Dartmouth-Hitchcock, and she might be able to speak to the concern vis-a-vis OBGYN workforce better than I could.
Thank you.
Okay, are there any further questions for Senator Hood? Okay, seeing none. Thank you very much, Senator.
Thank you, Madam Chair.
Okay, next we're going to hear from Ian Hewitt.
Okay. Ian, you should be all set.
Good afternoon, Madam Chair. Can you hear me?
Yes, we can.
Thank you. Ian Hewitt appearing on behalf of Cornerstone, and Cornerstone supports Regina Birdsell's proposed amendment to House Bill 233. This amendment fixes a lot of the difficulties that have been alleged with this bill in the General House and here before this committee. There's been some concern about the original bills requiring reasonable conduct, which is not clearly defined in the bill. The amendment would fix that problem by simply saying that any healthcare provider who withholds medical treatment from a born alive infant with the intention of causing or hastening the infant's death, and who thereby materially causes or hastens the death of the infant, shall be guilty of a Class A felony. That is, we think, really what the original bill intended to do. But the amendment will address this difficulty in a clear and defined way without posing some of the subjectivity problems that have been discussed here. There's also been concern about the alleged cruelty of requiring doctors to administer fetal treatment on a dying infant. Now, although we only support the amendment, we don't think the original bill did require fetal treatment, but the amendment will make that even clearer because no criminal penalties are going to be imposed under the amendment unless the doctor's conduct materially causes or hastens the death of the infant. So that's, of course, not going to apply if we agree that the treatment is futile and that the infant is already dying anyway. I'll just also note, it's interesting that a number of people have indicated that this bill, even as amended, is redundant under the current criminal law in New Hampshire. But at the same time, we're also hearing that it's going to alienate physicians and that it intrudes into the patient-provider relationship. And I'll just note, those things are logically contradictory. Both of those arguments can't be true. And I would just finally add that if this is an intrusion into the provider-patient relationship, we would say that, if that relationship needs to include the ability to cause or hasten the death of one's patient intentionally, then that's not the kind of relationship that the general court should be in the business of protecting. So thank you, and I'm happy to answer any questions, including any legal questions you have about the bill or the amendment.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Senator French?
Thank you, Madam Chair, and thank you, Ian, for testifying. Who'd be upholding these? Who would do the arrests? Who would do the prosecution? Would that be the Attorney General's office?
These could be prosecuted in the way that any normal Class A felony would be prosecuted. So a county attorney could prosecute them, not just the Attorney General's office.
And who would bring charges?
The charges would just be brought in the ordinary grand jury format that are used to, bring charges for any other kind of criminal homicide, an ordinary criminal homicide of an adult.
So as a Class A felony, the charge would be murder under this bill?
Technically, Senator, the charge would be a violation of this bill, but it would be akin to another kind of homicide, and it would just be prosecuted in the ordinary manner.
Okay. Thank you.
Thank you.
Are there any further questions? Okay, seeing none. Thank you very much for your testimony.
Thank you, Madam Chair.
Okay, next we're going to hear from Valerie Vallant.
Okay. Sorry.
Okay,
Got me again.
that's okay.
Ms. Vallant? Okay. You're all set to speak?
Hi. Great. Can you hear me?
Yeah, we sure can.
Thank you, everyone, for having me today. My name is Dr. Valerie Vallant. I am a graduating OBGYN resident at Dartmouth-Hitchcock, but I'm here on my own accord. I'm also starting community practice in Concord, New Hampshire, so I have very strong ties to New Hampshire and continue practicing there as well. I strongly oppose this bill for several reasons that Representatives Marjorie Smith and Tim Harrington kind of spoke about. It is a cruel, bad bill. I think Representative Jordan Ulrey, when he mentioned that it does not stop parents from holding their dying child, is absolutely incorrect. What this does is it creates a medical issue, a personal decision that is made between a patient and provider, and it creates a political issue that is having you all as senators, which, no offense, I have enjoyed all my medical training, but it has taken a lot of time and effort to do that. And it puts this decision in your hands rather than the hands of a medical provider. It takes away those last moments of life between parents and their dying child. And it causes unnecessary intervention, which I think, as again, we've heard, there's in place and trainings that are performed to allow us to resuscitate and assist in any necessary medical care. I just earlier today had a patient come into the emergency department at Dartmouth, and she spontaneously delivered a baby that we suspected was 19 weeks, and the child died in her arms. And if this bill was in place, because we are not completely certain, this was her first patient, she did not know she was pregnant, she perhaps could have been rushed to the neonatal intensive care and done unnecessary treatments and never seen the fetus itself as it delivered. And I think this is completely inappropriate and just incredibly cruel. And I'm just shocked that this bill is being proposed and has come to you all in the Senate. So I appreciate you listening to me today. I'm happy and I welcome any questions.
Thank you very much for your testimony this afternoon, Doctor. Are there any questions? Senator Khan?
Thank you, Madam Chair. Thank you, Doctor, for joining us. So this bill takes away rights of parents. Is that correct?
It not only takes away rights of parents, but it takes away the important medical decision-making of a medical team. There is no nation, as we have heard in the state of New Hampshire, where we have ever allowed a child to die. I mean, that is against the Hippocratic oath of medicine that everyone takes during their kind of medical training, do no harm. I think what happens in other states, whether true or false, I can't speak to that, but I have never met a healthcare provider who would ever be in a situation where we would ever allow any sort of infant to die on our watch unless there was a known fatal diagnosis, and only was the proper medical recommendation due to the neonatology assessment that we have already discussed here today.
And may I follow?
Yes, follow up, please.
That neonatal assessment, is that a universally adopted practice in the state of New Hampshire?
So there's several kind of levels of specialty training for it. There are hospitals, for example, here and in Manchester that have a neonatal intensive care nursery where we have neonatologists, which is a subspecialty training of pediatrics, who are ones really doing the best assessment of preterm, meaning any baby below 37 weeks that are then sent to those locations. It's Dartmouth and Elliott Hospital in our state. For providers such as myself and obstetrician, we do neonatal resuscitation protocols that we follow. It's a national standard and guideline that all of us are trained and updated on, I think it's every 3-year basis. The nursing staff on labor and delivery are also trained in neonatal resuscitation protocols. So everyone is well equipped and versed in the necessary steps that are to be taken to ensure all successful efforts. The only way that would ever change, again, if there is a particularly early labor situation of a non-viable baby that has a fatal diagnosis, and again, comfort measures only are what is kind of medically recommended. And so it allows parents to have those few dying moments with their child before it passes away.
Thank you.
Okay, are there any further questions? Okay, seeing none, thank you very much.
Thank you so much.
Next, we're going to go to Alyssa Antman.
Okay. Alyssa, you should be all set to speak.
Hi, there must be a mistake. I wasn't signed up to speak today.
Okay.
Sorry about that.
Thank you. Next, we're going to go to Emily Baker.
Okay. Ms. Baker, you should be able to speak now.
Okay, can you guys hear me?
Yeah, we sure can.
I appreciate the opportunity to testify or speak on this bill. My name's Emily Baker. I do something called maternal fetal medicine, which is a subspecialty of obstetrics. And it's been my honor to care for families in this state for the past 27 years. One of the things that I do puts us in this interface on a regular basis. We help our loving, caring parents to help navigate difficult decisions. If we have a patient whose baby has been determined to have a very serious condition, we have a long consultation. The pediatric subspecialists help parents. My discipline helps the parents. And we have very careful decisions that are made. And some parents facing some of these situations opt for palliative care. And they know full well what their children would have. And if they decide just to have comfort measures only, we respect that. And if there's a circumstance where they want complete intervention, we respect that. There are circumstances where the healthcare providers know that the baby has a good chance, and we, in a sense, do what we think is right. And if that means aggressive intervention, we do that. So I also point out what intervention means. So what happens is if a baby's born, neonatal resuscitation would include taking a metal piece of instrument, opening a mouth, putting down a rigid tube, maybe doing chest compressions, doing needle procedures. And that means that the baby is not with the parents and those things are being done. And I must say that that is a difficult situation for parents. often for parents who know that they've got a very short window of time that they can parent their children. And parenting means being with your child, holding them. And if they're taken from that, those are really meaningful experiences that are now gone from them. And the other circumstances which Dr. Vallant referred to is unknown situations where a baby could be born at 20 weeks or born that doesn't have a skull or some other serious condition where it's incontrovertible that there's no chance of survival. And there'd be fear on the place's part of healthcare providers that they might be prosecuted and face the risk of incarceration if they didn't do aggressive procedures, even they know in their hearts that it wasn't going to help anything. And it would make a very fearful workforce. So I won't go on because I think you're going to hear similar things and I don't need to say over what they already are, but I totally appreciate the opportunity to be able to speak, and I'm very much in opposition to the bill.
Thank you very much for your testimony, Ms. Baker. Senator Whitley has a question.
Thank you, Madam Chair, and thank you for taking my question and sharing your experience with these difficult situations. I'm wondering if you're concerned at all about whether this type of bill, even with the amendment, would make it difficult for the various providers involved in a situation like this to how it would impact the providers' trust among each other. I know there is a mandatory reporting section of this bill, and I'm wondering if you had any thoughts about how that mandatory reporting piece plus the requirements in this bill, how would that impact the trust among the providers managing this difficult situation?
Thank you for that question. I do have concern about that. I, as a physician, will interpret a circumstance and do the best I can. And I would have some level of fear that someone who walks into the room doesn't know the circumstance would then report what I could have, done or not done. And then who becomes the arbiter of that? Who knows more than the clinical professionals whether or not that was appropriate course of action? And I think we would have a level of fearfulness about the cohesion of the team and who would come in and make those observations, knowing for right or not right what it is. And so I'd be fearful of who was helping me take care of babies when I knew that one of the potential impacts for me could include a trial, public shaming, and incarceration. Those are situations where I wouldn't be able to be acceptable, and we would overtreat and have fear.
Thank you, Dr. Baker.
Okay, are there any further questions? Seeing none, thank you very much for your testimony.
Thank you very much.
Next, we're going to go to Krista Duval.
And I don't see Krista on the list.
Okay.
If you could raise your hand if you're there, Krista. I don't see a hand either, Senator.
Okay, next we'll go to Barry Smith.
Senator Carson, so sorry to interrupt. I just noticed that Representative Walper has his hands up, and I wasn't sure if you wanted to.
I don't have him on the list here. I don't have him signed up to speak. And we've got.
Do we want to wait till after?
Yeah, why don't we wait until after? Because as you know, with these sheets, all the people that wanted to speak are at the beginning of the list. So I'm just going down now through the list. Now, why don't we go ahead and put him through now as a courtesy to a representative, and he has 3 minutes.
Okay. Representative Walper.
Thank you, Madam Chairman. I apologize for not signing up. I was late to the ball game. I just have a couple quick things. I won't need 3 minutes. I've heard testimony about this interfering with the mother's right to choose and women's rights and that sort of thing. And I don't see any way that could possibly be applicable in this situation because this bill doesn't deal with anything until the baby is actually born. So whatever choices were made before that are moot. and they couldn't possibly interfere with them. And similarly with the doctor-patient relationship, it says nothing about the doctor-patient relationship. It simply says, especially with the amendment from Senator Birdsell, it says that that baby that's born is deserving of protection just like any other person in our state. To me, this is so common sense that it should be unnecessary. I totally agree with the people that have said that. And I don't want to have anyone think that the sponsors of this bill are implying that the doctors in our state are lacking in compassion or the level of care that they're giving. But we have seen in other states where those things do occur, typically not in hospitals, but they do occur, and dozens of babies have died from neglect or other actions of their supposed healthcare providers. So I look at this bill as a prophylactic, and that's about it. Any normally practicing healthcare professional would have no fear of this bill because it wouldn't ever affect them. We just heard about how it might cause them to overtreat. That isn't its intention, but I can see how that would be an unintended consequence. But I don't see that as a very bad thing either. So the Birdsell Amendment's a much better language than what's in the original bill, and I fully support it. And I urge you to as well. And that's all I have to actually say.
Thank you very much, Representative. Are there any questions for the representative? Okay, seeing none, thank you. Next, we're going to move to Maris Toland.
Okay, Maris, you should be all set to speak.
Hi, can you hear me?
Yes, we can.
Excellent. Thank you so much to the committee and the chair for allowing me to speak today. My name's Maris Toland. I am a resident physician in obstetrics and gynecology at Dartmouth. I live in New Hampshire, and I'm here speaking on behalf of myself in opposition to this bill. As you've heard before, as a healthcare provider, I strongly feel that this bill is unnecessary. I believe it's misleading, and I believe it's inappropriate. It are bills like this that perpetuate myths and lies about women and the providers who care for them. Frankly, this bill is emotional, I think, for a lot of healthcare providers because it feels like an attack against our sense of compassion, empathy, despite comments to the contrary. To suggest that I would not provide appropriate medical care to any patient I'm taking care of is insulting to the oath that I took in medical school and that I take every day in my career. I'd like to just take a moment to tell you a story about a patient that I had that I think can show a little bit about some of the unintended consequences of this bill. I'm going to call her Sarah, although that's not her real name due to HIPAA concerns. Sarah was a patient who came into the hospital and nearly lost her pregnancy due to complications. She underwent a procedure to try to keep her fetus inside so that its lungs and its organs could develop more and hopefully get her a few more weeks so that her fetus would be able to survive. Sometime after that, she came back into the hospital with very early labor and serious complications that threatened her safety and her life. She and her husband were so scared. And unfortunately, her baby was born early, very early, and much too small to survive. There was no procedure, there was no medicine, and there was no treatment that I had at my disposal that could have possibly saved that child. He lived for not even an hour, and there was nothing that I could do except to tell Sarah and to tell her husband that what happened was not their fault and that their son knew that they loved him. I remember how I felt when I handed Sarah her baby and she was able to hold him while they cried and while they spent their last moments together. I went into medicine to be there with families during moments like this, during joyous times, during normal pregnancies, but also tragic times like this. And to say that overtreating is not a bad thing, I think is not an appropriate grasp of the situation. I think overtreating can have really traumatizing effects for families. Dr. Baker very clearly talked about the kind of interventions that these infants have to go through for full court press resuscitation. And in the setting of futile, being able to save them in the setting of knowing that baby is too small to survive without the organ development to support life, it does prolong suffering. And these experiences can be traumatic for families for years to come.
Senator Carson, that's 3 minutes.
Thank you. I appreciate the chance to testify today.
Thank you very much. Are there any questions for Dr. Tolan? Okay, seeing none, thank you.
Thank you.
Next, we'll have Ilana Cass.
Okay. Okay. Alana, you all set?
Okay. Can you hear me?
Yes, we can.
Very good. Madam Chair and members of the committee, thank you very much for the opportunity to chat with you today in strong opposition to this bill. My name is Ilana Cass. I'm the chair of obstetrics and gynecology at Dartmouth Hitchcock Medical Center in Lebanon. And while trying to cut to the heart of the matter, I would suggest to you all that the sentiment of this bill, as articulated by Senator Carson, is to include treatment with humanity when caring for these very tragic circumstances in which a newborn is born either severely prematurely or with a condition which is not viable, which is not able to sustain life. And I would suggest to you that the harm of this bill, in my opinion, speaking as a provider for women over 30 years, is that the bill attempts to define the care that is permissible according to politicians or legislative bodies rather than current medical science and the very sort of hallowed contract between a physician and the patient and her family. I would suggest to you that I think the sentiment of allowing that newborn to be treated with dignity does not and should not include necessarily attempts to save that life. In fact, to the contrary, depending upon the circumstances as articulated by my colleagues and some of the tragic stories you've heard in which life would not be possible, I would suggest that I think that Senator Carson's sentiment that to treat that newborn with dignity actually includes the options of making those final moments of that newborn fetus's life as comfortable as possible in the arms of its mother or family, and that interventions which are futile can be, as my colleagues have suggested to you, not only unnecessary, but significantly traumatic. So I think the sentiment of the bill is commendable, but this is not something this is the definition of what that care is defined by is not in the purview, with all due respect, of legislative bodies and of politicians. Rather, that is very much should remain and must remain within the context of science and the very important relationship between a provider and the patient and her family.
Okay, thank you very much for your testimony. Are there any questions? Senator Khan?
Thank you, Madam Chair. Thank you, Dr. Cass. And wanted to follow up on the profession. How many graduates do you have a year from Dartmouth?
Senator Khan, we have 4 graduates.
OB/GYN practice.
Thank you very much for that question. We have 4 graduates a year.
That's a slim number. Are we able to retain those graduates in New Hampshire?
Well, indeed, it is a small number, and I think to this august body, it is not a surprise that many of the graduates choose to remain in practice here in New Hampshire because it is such a beautiful place to live and practice. But if you would indulge me to address Senator Whitley's concerns vis-a-vis the reduction in workforce that may result from this type of legislation, I can only share with you the data that we have in front of us with respect to not only the healthcare crisis that existed prior to COVID, but now similar concerns that have all been amplified. We know already there has been a significant reduction in hospitals that offer obstetrics and gynecology care here in the state of New Hampshire. And this has all and will all be escalated as a result of COVID for reasons that I think are evident to this committee. My concern would be, therefore, that to add legislation that would potentially result in felony convictions of providers who are uniquely positioned to care for the families of New Hampshire, in my opinion, would further exacerbate the healthcare crisis that we could potentially face in this state.
Thank you very much.
Thank you very much for your, Senator French has a question.
Thank you, Madam Chair, and thank you, Dr. Cass. Could you tell me, do parents have the right to withhold medical assistance to their children for religious reasons?
Thank you for that question, Senator French. They absolutely do.
Okay, thank you.
Okay, Senator Whitley.
Thank you, Madam Chair, and thank you for addressing my initial question to Senator Hood. Sort of building on that question, I'm wondering if we know we have workforce shortages, we know that's an issue, particularly in OBGYN, and I'm wondering, if you could speak at all to access to OBGYN care, particularly for our rural communities in New Hampshire. Is that at risk? What will this bill do for that issue?
Thank you, Senator Whitley, and I think you highlight an incredibly important a question, which is the data, again, that we have, which clearly notes a discrepancy or a disparity, a healthcare disparity amongst rural populations and more urban populations. So we face a crisis to some extent in New Hampshire with data that clearly shows a poorer outcome for our families and specifically pregnant women when they are in rural populations. To further constrain that healthcare system with fewer providers would again really would create more divide and exacerbate the disparities in care. And this becomes very relevant in a state where there are not very many, speaking to Senator Khan's question, there are not very many graduates of residency programs on an annual basis that come out of the state of New Hampshire.
Thank you.
Okay, thank you very much. Next, we're going to go back to Dr. Barry Smith.
Can you hear me?
Yes, we can.
Oh, thank you. I'm very proud of my former colleagues who have put a lot of facts on the table. For the record, my name is Barry Smith. I'm an obstetrician. I've been in New Hampshire since 1970, practicing. I was the chair of Dartmouth-Hitchcock for 25 years. And I want to be a little blunt. This bill is not simple, and it doesn't stand on its own because it has a chance to affect the whole way we deliver maternal and child health care to newborns and pregnant women, as has been very nicely intimated by several people from the chair down to the resident level. We have spent 50 years building a system that has excellent results. It's a very fragile system based on limited number of people and getting more limited in some areas every day. Just for the record, we have 5 maternal fetal docs in New Hampshire and 8 neonatologists, and they're not all over the state. So we have built a system of collaboration, which is unique and actually looked upon by other parts of the country very favorably, because we work with all New Hampshire hospitals, Vermont hospitals, and many Maine hospitals. And as Dr. Cass was saying, we only turn out 4 residents a year. University of Vermont turns out 3, Maine turns out 4. All 3 of the states are searching for obstetrician gynecologists, even harder searching for maternal fetal medicine people and neonatologists. So if a bill goes through like the one that's been proposed, even with the amendment, and you're putting a sword of Damocles or whatever you want to call it, potentially over the head of potential obstetricians in general, and especially the subspecialists who are called upon to make the toughest of decisions, why would they want to come practice here? That would, because we're in a buyer's market at a lot of times, and after we recruit, we need to retain. We've been very lucky to get excellent people. Dr. Baker talked about the team approach. If you wanted, obstetrics is a team sport, and if you want to destroy the team, just have one person picking at the other to see who's going to get in trouble the most, and we'll just do everything possible. I think you'll hear from some other speakers that will tell you how most of us feel this is really harmful to the fetus, to the family, as well as to the providers. The Hippocratic Oath's been mentioned a couple times. Do no harm to mention. You are asking people to do things to fetuses that we all know is not going to help them and is harmful. That is, you're asking people to break their oath because somebody else who hasn't spent 8 years in training thinks that that's the ideal thing, and it is not. You have to give some credit to experience and training, and also, how about a little trust for the physicians? There are other ways to deal with physicians and nurses if you feel that they're breaking the trust that they were entrusted with by being licensed. This is not the way to do it and put the whole system of care at risk. And I can tell you, as the old man on this phone call, on this Zoom meeting, that it's taken many, many people tremendous effort to build this system. It'll take very little to destroy it. And that would be terrible for the rest of the citizens of New Hampshire, as well as across northern New England, who deserve excellent care. I'd be happy to answer questions but I know other people are going to talk about this. Just so that you know, this is a common issue, as was intimated. Obstetrical deserts is the word that's being given now across rural America for where obstetrical care is not available. That includes New York State. That includes where there's half the counties don't have an obstetrician. And the North Country of New Hampshire has right now very little coverage, and most of the people are far along in their careers. It will be very hard to replace them by young residents who do not want to go to small hospitals. They want to be with other colleagues for lots of good and reasons that I'd be happy to discuss. I hope you'll read the written testimony that I sent in, which is in more detail.
Thank you very much for your testimony, Dr. Smith. Are there any questions? Okay, seeing none, thank you. Next, we're going to go to Susan Bartlett. I'd like to remind right now, to everyone that's listening and people that are waiting to testify, we've heard a lot of testimony already this afternoon. I'm going to ask you not to repeat things that we've already heard. We're interested in hearing new things. And please, if you have written testimony, do not read your testimony. And we are still allowing 3 people to testify for 3 minutes in an effort to make sure that we have heard from everyone who would like to speak. So that being said, Ms. Bartlett, welcome
yes,
to the committee.
Can you hear me?
Yes, we can.
Okay, thank you, Madam Chair and the Senate Judiciary Committee. I am writing to you in strong opposition of this bill. I've been a midwife and a high-risk obstetrical nurse for 40+ years. And I've attended many women who have gone through the problems that we've all been discussing. I have held women and their families as they have had to make these horrible decisions. I've been present at these deliveries, and it's just a devastating decision or choice that women are making. But it's incredibly important for women and their families to be able to continue having this choice, and to be able to be having their providers give them the expertise and knowledge that is so important. One of the most important things, I believe, is that women are not making these monumental decisions in a vacuum. They're being educated by the team and by all the professionals in the OB and the pediatric teams. It's just amazing to me that this bill doesn't just say that physicians are going to be jailed and fined and threatened with a Class A felony. It also includes the entire OB care team and possibly the NICU team. And that includes people such as myself who have supported women within these last many years. I was a neonatal resuscitation provider. I was certified. I'm semi-retired right now. I've been basically giving vaccines for the last 2 months voluntarily, but I feel very strongly about this issue that that women be able to get the advice from their obstetrical team and their pediatric team without having people who have no sense of what the actual reality is of these situations. I'm happy to take questions.
Thank you very much for your testimony, Ms. Bartlett. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to go to Michaela Sawyer.
Okay. I do not see Miss Sawyer on the list anymore.
Okay, we'll move on. Let's go to Devin Chafee.
Okay. There. Okay, Miss Chafee, you're all set.
Thank you. Thank you, Madam Chair and honorable members of the committee. My name is Devin Chafee, and I'm the Executive Director of the American Civil Liberties Union of New Hampshire. And I appreciate the opportunity to testify today in opposition to HB 233. And I just want to start by saying that I really appreciate that I think the majority of the discussion here today has been very appropriately focused with regards to this bill. HB 233 is not about abortion. It's really about end-of-life care. And of course, any of us who has had to make an impossible decision of when to take a loved one off of life support or has had to be at all a part of such a difficult decision understands how excruciating having to make those decisions can be. And like a family's decision about when to end life support, the decision about how to treat an infant, including putting an infant on life support, should be left to the infant's parents, their faith, and their doctor. HB 233 impacts families facing what are just impossible decisions. You know, an infant might have only hours or day to live, and a family has to decide how they're going to spend the time that they have left with that child. And this bill could deny parents the ability to choose the type of care that works for their family and that works for their faith in these situations. And what I'd like to encourage the committee to consider for a moment, please, just how would you approach this situation, end of life decision, if a child were dying at age 1 or at age 5 or even a baby at 6 months? You know, how would we think about that? I think that we would entirely trust the parents and in consultation with their doctor to make the best decision. And yet, and I think we've heard a number of providers speak to this today, this bill really says that parents and doctors can't be trusted to make such end-of-life decisions just because this tragedy happens to be happening sooner after birth. End-of-life decisions are just so hard. And legislation like this, it really doesn't do anything to help families or doctors. So for these reasons, I respectfully urge the committee members to deem this HB 233 to be inexpedient to legislate. Thank you very much.
Thank you very much for your testimony, Ms. Chafee. Are there any questions from the committee? Seeing none, thank you. Next, we're going to hear from Dr. Stephen Ringer.
Okay, Dr. Ringer, you're all set.
Yep. Thank you very much. Thank you, Madam Chairman, and all the members of the committee.
for the opportunity to testify. I'll be brief because a lot of what I have to say has already been said. I'm a neonatologist. I practice in Lebanon and Manchester and live in Hanover. And I've been a neonatologist for about 35 years. I worry about this bill because, as you've heard, the unintended consequences of the bill may place families that are in the midst of critical situations, facing a child who may be born so prematurely that they cannot survive outside the womb, or a baby with a severe medical condition that's incompatible with continued life, and casting a pall on that situation that makes caregivers err on in the direction of providing invasive, unnecessary, and frankly unethical care for the dying patient. And I've heard already from pediatricians across the state who we support, because again, these patients aren't just being born in bigger centers that have neonatologists. They're being born in all of the birthing hospitals and emergency rooms across our state. And they raise considerable concern and worry because they feel that this bill would place them in a situation of doing things that they know to be wrong, that interfere with the family's few moments with the baby, and end up forcing them to do something that's actually wrong. I think Dr. Smith highlighted the fact that this is not a simple situation, and it requires an inordinate amount of complexity in medical care and counseling, as Dr. Baker alluded to. And I think that should remain the provenance of the patients and their caregivers. Thank you very much.
Thank you very much for your testimony. Are there any questions for Dr. Ringer? Seeing none, thank you.
Thank you.
Next, we're going to go to Dr. Young.
Okay. Dr. Young, you should be all set. Dr. Young, you can unmute now.
You hear me now?
Yes, we can.
Thank you for allowing me to testify in strong opposition to HB 233. My name is Og Young. I practiced obstetrics and gynecology in Concord for 35 years. I'm the past president of New Hampshire Medical Society and continue to represent New Hampshire obstetricians on our general council. Finally, I'm an adjunct professor of OB/GYN at Geisel School of Medicine, teaching medical students for 40 years. I speak on behalf of not only the Medical Society, but also New Hampshire Obstetric, Pediatric, Family Medicine, and Psychiatric Associations when I stand in opposition to this bill. I'll be very brief. There are just three things you need to understand to vote in opposition to this bill. First of all, no viable baby has ever been left to die in New Hampshire. This bill implies that there are births where no care is rendered, but that's just not true. In 40 years of obstetrics, including my 5 years of resident training, I never witnessed nor heard of a term or near-term baby being left to die. Secondly, and you've heard a lot about this, many babies are born alive, but suffer severe prematurity or a fatal fetal diagnosis with no chance of survival. I've been there with many women at these births. These mothers just want to hold their babies for a few minutes or hours that they live. This time is often spent making memories, footprints, or taking photos just to give them comfort and peace. Few would ever think to intrude on these moments of loss. But this is what Born Alive Protection Act calls for. This bill does not protect anyone. Imagine taking a newborn away from their mom to make futile efforts to try and save a baby that can't be saved. Finally, and this has been spoken to as well, this bill would, if it became law, would make physicians liable or could be charged with a serious crime while providing love and empathy and appropriate hospice care. Often these doctors are high-risk obstetricians like Emily Baker and our neonatologists who serve a vital role in saving infants that can be saved. As Barry Smith pointed out, we would have a very difficult time recruiting these important physician specialists if we make HB 233 law. New Hampshire has the second lowest perinatal mortality rate in the country. If this law is passed, I guarantee you we're going to jeopardize that status. In summary, this bill is cruel to babies whose suffering might be prolonged. It's cruel to parents who just want to be with their babies for the short time they live. And it's wrong for physicians whose role in these circumstances is to provide empathy and support for women who must choose the course of care they can best live with. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to go to Sarah Connors.
Okay. Is this Sarah Connors?
Yes, it is. Sorry about that. I didn't realize I was muted. Hi. So I am actually going to be testifying as quickly as I can on the opposite side of the spectrum in a couple of regards. I was the parent who was given a poor prenatal diagnosis. In 2010, I delivered a child who only lived for an hour and 47 minutes after she was born. We knew from 9 weeks that she was going to have problems. So as far as the more emotional impacts of these statements that are being made by physicians, I have a very intimate and maybe more of an intimate understanding of what's going on than the doctors do, because I experienced it and I didn't go home and leave and go back to my life. I had to, for 10 years, I briefed my daughter. I need to clarify that nothing that I'm saying is in any way because of that. I wanted to clarify, I do know I am not negatively trying to impugn any of these doctors or try to say that they're not caring. But I do have a couple of things to say about this. I support this bill. Many of the doctors that you're speaking to are their experience is in hospital work or working in clinics that are meant to be delivering babies that are going to live. The situations, even with the neonatologist and the maternal medicine doctor, are different because they are more complicated care pregnancy. But what I'm looking at, this specifically speaks to what's going to happen in a clinic or when a woman is intentionally terminating a pregnancy. I understand there are parameters here that will affect other care, but in my situation and where I've looked at for the last 10 years doing this kind of work, because this is what I do, I support moms working through these pregnancies. It is not true that doctors will always go and care for the child that's born after these situations. Okay, there are laws being worked through the entire country. Simon's Law is one of them, where they are having to force hospitals to notify parents when they are putting DNRs in children's charts. So it is absolutely not true that doctors will always care for children. When the children has serious birth defects, but that are survivable, like trisomy 13 and trisomy 18, doctors do have to be encouraged to care, and parents are having to remove their children from these facilities and move to other facilities. They may not agree with this and they may not like how I'm characterizing this, but it's a reality because we wouldn't need laws against it if it wasn't happening. Okay, the second thing, a couple of the stories, and I'm sorry, because it's only 3 minutes and almost every story that every doctor has told in this situation has been a story of where the child would have like the Valerie Vallant's story, the baby was, Dr. Vallant's story, the baby was 19 weeks old. Reasonable care would have been to not give that child palliative or not give that child intensive NICU care. The emotional aspects of these stories have no bearing on whether the child itself has a right to medical care. I understand, like I said, I experienced this as a mother, and I understand the emotional involvement here, but children have a right to medical care besides what even the parents want. Okay, we can't decide as parents to withhold medical care from our children because they may be seriously disabled. Reasonable medical care means that if the average person knows that the child is going to die or a doctor, then they get palliative and hospice. And I saw your 3 minutes. So thank you very much.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to Robin Nafshi.
Okay.
I actually prefer to testify on HB 625. I apologize for having indicated an interest in testifying for both, but I do also want to register my opposition to this bill.
Thank you very much, Rabbi. Okay, next we're going to go to Dr. Burton Dibble.
Okay, Dr. Dibble, you should be all set to speak.
Good afternoon, Madam Chair, and thank you for the opportunity to give testimony on this important bill. I'm a family physician. I've practiced in New Hampshire for 44 years. Much of my practice career included obstetric care, and I have been a president of the Medical Society, a member of the Board of Registration in Medicine. I could not testify more eloquently than Dr. Smith and Dr. Young and Dr. Baker about the medical aspects of this situation. I think there's a point that could be made a little more clearly that would help us to think successfully about the issue. I find myself in hospice care at the present time. And the point of hospice care is to maximize the quality of life of the people that we take care of. And there are times when we come to a place with our loved ones that there is not any doubt about the outcome. And it is important to have the most caring and humane structure and attitude to get to what is best care. And best care does not, certainly in the advanced age group, mean more supportive care. It means best supportive care. And in the case of the infants that we're speaking of, best care may not necessarily be more care. And I find the definition, the supposition that this bill addresses to be completely contradictory in that way. So I speak vigorously in opposition to the bill, and I appreciate the opportunity to be heard.
Thank you very much for your testimony, Dr. Dibble. Are there any questions from the committee? Seeing none, thank you again very much. Next, we have Emily Heath.
Okay. Emily, you should be able to unmute now.
Thank you. Can you hear me?
Yes, we can.
All right. Thank you. My name is the Reverend Dr. Emily Heath, and I'm the senior pastor at the Congregational Church in Exeter. It's Holy Week, which is a busy week in my line of work, but I was concerned enough when I heard about this bill that I felt it was important to be here to oppose this bill. You've heard from a lot of folks testifying today, physicians who have spoken about the medical concerns here, but I'm just a New Hampshire pastor, and I'm here to talk a little about the religious and spiritual concerns. I'm a former chaplain, including a chaplain for a children's hospital and for a hospice, which means I've spent a lot of time with families facing end-of-life decisions. And so unfortunately, I've watched many parents lose their children. I've watched them have to make decisions about what kind of extraordinary care they want for their children. And I've watched ethics boards work with parents to decide what the best ethical outcome is. I've watched parents even stop children from being coded because they saw that the child was not going to be saved and they didn't want their children's last moments to be moments of pain. And I've learned that sometimes the best and most ethical thing is comfort-only care. Working in postpartum settings, I've watched parents have to choose between doing everything possible despite a likely negative outcome and having a more compassionate hospice-like approach to the end of their children's lives. I've baptized many babies who are dying. This is a sacred time for parents and for families, and that time, both the sacrament and the time with the child, often helps the family to cope with the loss and the grief. Religious rituals are important. We need the time and space to be able to do them well. In terms of baptism, Christians hold that the baby must still be alive, so being allowed access to the child during that time is crucial. This really is a matter of religious liberty. We also need time for the children to be with a child, to mourn, to pray, to not be away from them rather. So I'm asking you, please do not put medical personnel in this kind of bind where they're going to have to wonder whether they're going to be arrested or prosecuted or not. They are clearly concerned. Look at how many physicians have shown up today to testify to this. So I'm asking you to trust parents, trust our medical personnel. Mostly just don't politicize and interject government into this very sacred and holy moment. Thank you all for your time.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you.
Thank you.
Next, we'll have Elizabeth Canada.
Okay. I do not see. I do not see her on the list, Senator.
Okay.
Oh, I'm here. Hi. Hi
Sorry.
there. No worries. Hi there. Thank you, Chairwoman Carson. And good afternoon, Senate Judiciary Committee members. My name is Elizabeth Canada. I'm the Advocacy Manager from Planned Parenthood New Hampshire Action Fund and Planned Parenthood of Northern New England, and we oppose House Bill 233. House Bill 233 has the word abortion in the bill text, but I want to be really clear that this bill has absolutely nothing to do in actuality with abortion. It's an inflammatory allegation meant to confuse people, but this bill would have no impact on those seeking abortion care. Like it's been mentioned, this bill has to do with early labor or a fatal fetal diagnosis. This bill would directly impact individuals and families who are experiencing much wanted pregnancies, who are planning on giving birth to their child they expected to bring home. And because of these incredibly complex circumstances involving early labor or a fatal fetal diagnosis, their infant will not survive. We're talking about devastating circumstances. We're talking about families who have days or hours or minutes with their newborn before that child passes. And passage of this bill could dictate how they can and cannot grieve their child in those precious and final moments. The language in the bill text says that all healthcare providers present at the time of the birth shall take all medically appropriate and reasonable actions to preserve the life, or they face a Class A felony. And so the providers aren't really given a choice. Their thought process will have to be, can I allow this family to hold their child as the child passes? Can I allow this family to have their child baptized? Can I allow this family to introduce the newborn to their older siblings? Or if I do any of those things, will I go to prison for 7.5 years? And so they have to consider using fetal treatments, connecting the newborn to machines that simply won't work in these tragic situations, but will only separate the newborn from the family because of that threat of a Class A felony. Because those supporters of this bill have claimed that there are no mandates in House Bill 233, that is just not true. Because this bill carries a Class A felony for healthcare providers, and a Class A felony means a minimum 7.5 years imprisonment. This bill creates a chilling effect on the patient-provider relationship, and it pits healthcare providers against one another. These families are in the most devastating moments of their lives, and this bill would make this time for them even worse. So like all laws, there are consequences. And in this case, these consequences would tragically impact families who are already grieving. And so we urge you to vote ITL on House Bill 233.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to go to Dana Pierce.
Okay. You should be able to unmute.
Hello, can you hear me?
Yes, we can.
Okay. And I actually had, I would like to testify in opposition to House Bill 625. I think there was a mix-up as well. I'm sorry about that.
Okay, that's fine. Thank you. Next, we're going to go to Jason Hennessy.
Okay. Jason, you should be all set.
Hey, can you guys hear me?
Yes. Yes, we can.
Wonderful, thank you. Honorable members of the Senate Judiciary Committee, thank you for hearing my testimony. My name is Jason Hennessy. I'm the president of New Hampshire Right to Life, New Hampshire's largest organization that is focused on life. I'm also a resident of Amherst, New Hampshire. And New Hampshire Right to Life enthusiastically supports HB 233. Article 2 of the New Hampshire Constitution states, all men have certain natural, essential, and inherent rights, among which are the enjoying and defending life and liberty. As our legislature, protecting life is a central part of your charge. One point that several of the testifiers have avoided discussing is that this bill would affect babies that are born out of an abortion. In an abortion clinic, the parties who are there either chose to kill the now-born baby or are being paid to. There is no debate about whether the child who's now born is a person under our laws. They've taken a breath, they are separated from their mother. There's just no gray area. There is a compelling state interest to represent the interests of the baby, and this legislation does just that. As to the testimonies you heard, this bill only requires medically appropriate and reasonable actions. Using extreme measures to help a baby born that's not deemed viable would not prevent things like baptism or taking footprints or anything like that. So one of the questions that I've heard is, does this actually happen where a baby is born that was meant to be aborted? And the answer is it does. Dr. Kermit Gosnell is an abortion doctor convicted of murder for snapping the necks of baby born after abortions. Without this bill, in New Hampshire, Gosnell could have avoided conviction by letting the baby simply die of dehydration or starvation. The Lozier Institute quotes some CDC statistics that also document this. There were 143 babies born after abortion between 2003 and 2014. In just 2017, Florida documented 11. And the CDC states that these are gross underestimates because these types of statistics are not regularly tracked. Many have survived and thrived, including one who wrote a book and advocates for life for other babies born in similar situations. Here in New Hampshire, we don't know, because New Hampshire is one of only 3 states that doesn't track abortion statistics, primarily thanks to the abortion industry lobbying against bills that do that. I'd also like to address Representative Smith's desire to leave this in the realm of professional licensure. In our society, we don't typically leave felonies up to private industry boards, and I don't think we should start now. With that, I thank you for your time and would love to take any questions.
Thank you very much for your testimony. Are there any questions? Okay, seeing none, thank you very much. Next, we're going to have Michael Luchtenberger.
Okay. I do not see Michael. I do not see Michael on the list, Senator.
Okay, let's go to Laura Abel.
Okay.
Okay.
Laura, you should be all set to unmute.
Good afternoon, ladies and gentlemen of the Senate Judiciary Committee. My name is Laura Abel. I live in Madison, New Hampshire, and I'm here in opposition to H. Bill 233. Please excuse me because I'm crazy nervous about this. This is a very emotional and difficult thing for me to do. I'm testifying here as both as a patient, and then I'm also an EMT. So I've kind of seen this from two different aspects. I've submitted a written testimony so that describes my situation more clearly or more detail. So I won't say anything about what my written testimony says. Suffice it to say that, excuse me, I was 23 plus weeks pregnant and ended up in the hospital with broken water, broken amniotic sac. And my baby, we were so thrilled to be becoming parents and scared to death, as you can imagine, suddenly something like that happening. The doctors tried to keep me from losing her, but ultimately she was born and her heart was beating, but her eyes were fused shut, which they had told us would mean that her lungs were premature. She was weighed, measured, and swaddled. She was baptized. Her name is Allison Joanne. She's born in Nashua. The wonderful people at Nashua Hospital swaddled her, gave her to us, took photos of her, and left us with her so that we could feel what it was like to become parents. Instantly trying to protect this poor little girl who weighed 1 pound and 6 ounces. There was nothing wrong with her except that my water broke. She was perfectly healthy, but she wasn't going to survive. She wasn't breathing, but her heart was beating. And now as an EMT, I understand that we would have intubated this poor thing. I wouldn't have, I don't have the qualifications, but somebody would have intubated this poor little being, this poor little creature. And we had 40 minutes before her heart stopped beating. And in that time, we just wanted to protect this poor little thing. And these people were so professional with us and so kind and so caring, knowing that there's a chance that they would have had to intubate her and work her to keep her alive. It's just horrifying to me that anything like this could have interfered with what we were trying to do. Allison is buried in Nashua, and we go see her sometimes. We're forever grateful for the gifts that she gave us, like showing us how I can't even profound becoming parents is. What a profound experience that is. And to have missed that, to not have been able to hold her, because they would have had to take her out of the room because, we weren't where any of those machines and any of that equipment is, would have just been absolutely devastating. It was devastating enough going through what we went through. And, leaving the hospital with empty arms is not something any person wishes on anybody. And so thank you very much for allowing me to speak today. And I'm finished. Thank you.
Thank you very much for your testimony, Ms. Abel. And please accept the committee's deepest condolences on the loss of your daughter. Are there any senators who have any questions? Senator Whitley.
I don't have a question. I just also wanted to share my thanks to Laura, who came and shared this story. And I'm sure that was very difficult, and you're very brave, and I'm very grateful.
Okay, thank you very much, Ms. Abel.
Thank you.
Next, we have Michelle Campbell.
Okay. Michelle, if you are on, can you raise your hand? I do not see her, Senator Carson.
Okay, let's go on to Kelsey Wilson.
Okay, I see a Kelsey with a different last name. Kelsey, is this Kelsey Wilson?
No, it is not. I did not have a chance to sign up on time, so I believe Kelsey Wilson should be going first.
Okay, thank you. Okay. Is Kelsey Wilson on the Zoom? If you could raise your hand.
Nothing?
Nope.
Okay, next we're going to go to Joanne Carrier.
If Joanne is on the call, could you please raise your hand? And if you're on the phone, you can do that by dialing *9. I don't see her either, Senator Carson.
Okay, how about Chow Kelly?
Yes.
Hello.
Hello.
Hi.
Hi.
Okay, can you hear me?
Yes, we can.
Okay, yes, this is Chow Kelly speaking, and thank you for taking my call. I'm calling to support both of the bill, HB 625 and HB 233. This week is a Holy Week, and the sixth commandment from God is thou shalt not kill. So I've heard a lot of doctors and nurses testify about liability, but the biggest liability we all should be concerned about is when we have to answer to God, not to human. So the wonderful doctors and nurses doing wonderful work, they shouldn't have to be worried because of, potential liability. Save lives first, please. Thank you so much. And by the way, please work toward end all abortions. Thank you.
Thank you very much for your testimony, Ms. Kelly. Are there any questions from the committee? Okay, seeing none, thank you.
Thank you.
Next, we have Kelly Potenza.
Okay. Kelly, you should be all set to speak.
Can you hear me?
Yes, we can.
Is the woman that her name was Sarah, that was talking about her personal story, she was cut off, is she still on? Because I'd love to give her my time. I'd love to give her my 3 minutes. I sent you guys my testimony in strong support of this. It pretty much just speaks to what she said. And I don't know if Sarah's still on, but if she is, I think that someone that experienced it personally could really speak to it better than I can. So is she still on? Can I do that? Give her my time?
I'm not sure. I'm looking at the names. And are you talking about Ms. Abel, who was talking about her daughter, Sarah, that passed?
No, it was another supporter of HB 233.
Yes, she is on, Senator Carson, if you would like me to.
Oh, is it Sarah? No? Okay. All right. Well, all right. Thank you very much, Ms. Potenza. We'll put her through.
Thank you.
Sarah, you should be able to speak again.
Yep. Hi. So I just did want to say that I apologize again if I'm trying to go through this quickly because there are only 3 minutes. I'm not being emotionless. I did want to say I'm sorry for the loss that one of the previous speakers suffered. I know how that feels as well. But the problem is that sometimes medical physicians have different viewpoints on end-of-life care than the average person does, and they can influence people's choices when it comes to their children. And unfortunately, if there's not some kind of stop guard in place, they have a lot of room to make decisions that could affect people's lives and in a very negative way. I personally have been for the last 10 years supporting women who have continued pregnancies after receiving a poor prenatal diagnosis, and have known a number of women whose children ended up being perfectly normal after the pregnancy was diagnosed poorly, but I also have known a number of families who have been denied medical care for their children at birth. I'm thinking, you know, the idea that doctors don't do this is inaccurate. We all know in 2017, Amanda Finnenrock held her 23-week-old twins, begging doctors to take care of them, and they refused in Ohio. The doctors were sanctioned after that, I believe. There have been court cases over it. So this does happen. And to pretend like it doesn't, because we all know that doctors want what's best for our families. I trust my doctors very much so. And I took counsel from my doctors when my daughter was dying and accepted what they had to say. But the idea that just because they are doctors, that they automatically are always going to have those best interests, particularly when a pregnancy is being intentionally ended, that's foolish. It's there's everybody has to follow rules, everybody has to follow laws, and we can't have one group of people that there is no instruction, no stricture for them to not be doing this. I'm sorry, but this is the idea that they can just decide for themselves when somebody's going to live or die is foolish. We see it, like I said, with Simon's Law having to intentionally pass laws in multiple, I think Missouri, Arizona, and multiple states now having to intentionally go into state legislatures and pass laws to make sure parents are informed before DNRs are put into their children's medical charts because of fetal care. The lack of fetal care laws is a problem. And this is real, and we have to address this and look at this in the context of this particular type of bill. I don't know if I'm near my 3 minutes or.
Yes. Okay. You are at 3 minutes right now. Thank you.
Thank you very much for the additional testimony, Sarah. We appreciate that. Next, we'll go to Nancy Glynn.
Nancy, you should be able to unmute.
Hello, thank you so much, Madam Chair and fellow members of the Senate Judiciary Committee. Thank you for hearing my story today. My name is Nancy Glenn, and I live in Sutton, New Hampshire. I oppose HB 233, and I hope you will take my personal experience into consideration. We go back now almost 6 years. In June of 2015, I was in the hospital because of complications in my pregnancy, and I was being prepped for an emergency C-section. I am brought into the operating room with my husband by my side. Alongside us were also 3 nurses. We entered the room and there were 4 nurses from the NICU, 2 anesthesiologists, 1 maternal fetal medicine doctor, an OBGYN, and a neonatologist also from the NICU, as well as 2 more people that I'm not exactly sure what their role was there. If you add all of those people together, you get 14 people, not counting my husband and I. It was a crowded space and it was a really serious situation. C-sections are quick, and within a half hour, my beautiful son, Sawyer, was born. The nurses and doctors immediately started to work on him. You know, he was having trouble breathing. They were trying to make sure that he was maintaining his vitals. About an hour later, there was still a struggle to keep Sawyer intubated. He was so tiny. He was 25 weeks. The nurses and doctors continued, and the neonatologist came to me and my husband and said, "We can't keep the tube in." I started screaming at the doctor, asking him, like, what do we do now? As my emotions were at an all-time high. The doctor froze and he wasn't sure how to respond. My husband recognized the doctor was trying to say and very calmly asked, "Give us our son, keep him comfortable, give us our son." The doctor and the other providers understood and respected our ask and brought Sawyer to us. It was the first time that I got to see him. Sawyer was then placed on my chest with my husband's arms wrapped around him. He was beautiful. We spent every last moment together as a family. We spent the time memorizing his face, telling him how much we loved him. If I close my eyes and listen really close, then I can still hear that sweet, sweet sound of his little breaths. I kissed him on the forehead and then he was gone. Those minutes with him are the only memory I have. And I cannot begin to describe to you what those moments have done for my emotional and mental healing. I'm forever grateful that the medical providers listened to me and my husband and ensured we had the time to spend with Sawyer and make that sweet memory that helps me through every single day. A wise pastor once told me that the greatest pain one could ever experience is the loss of a child, that losing a child takes you to the deepest, darkest pits of hell, and you either come back stronger and more fierce than ever, or you stay in those deep, dark pits and allow it to consume you. I know that the memories I was able to have with Sawyer ultimately have made me stronger and more fierce, strong and fierce enough to care for Sawyer's older brother, Hunter, who will be 9 on Thursday and also experiences different abilities, strong and fierce enough to be an active member of my community, strong and fierce enough to share this story with you today. I strongly urge you to oppose HB 233. I am one of many who has lost and will lose a child. Every parent should have the opportunity to have those last moments and make those memories with their baby so they can too be strong and fierce for their families, their communities, as well as themselves. Thank you very much for hearing me today.
Thank you very much for your testimony, Ms. Glynn, and please accept the committee's condolences on the loss of your son. Are there any questions? Senator Whitley.
I also wanted to share my gratitude for you coming to this hearing today and powerfully sharing your testimony. I recognize it is not easy. I'm a mother also, but I'm so grateful for your story and for your conviction and sharing with us today. Thank you.
Okay.
Thank you.
Tricia, that was the last of the folks I had signed up. Are there folks in the waiting room?
We have Kelsey Mercurio, who has had her hand raised.
Okay. How many, do we have any kind of an idea how many people have their hand raised?
People are raising hands now. I have 4 right now. Representative Stapleton, and then 4 others.
Okay, why don't we go to Representative Stapleton, and then we'll go through the other 4. The other 3. Good afternoon, Representative. We have a 3-minute time limit here. So please give us your testimony.
Thank you, Madam Chair, and thank you for members of the Senate Judiciary Committee for having me on here. The purpose of law is not only to prevent bad things from happening, but as a guidepost for behavior so that we can enable good things to happen. And we know that there are some awful, horrible things that have happened in our country relative to abortion and the loss of life that could otherwise have been viable. Doctors Carhart and Godsdell and Philadelphia, for instance, are just 2 examples. This bill does not impugn doctors' honest abilities and intents to save life, preserve life, heal. And we think that this bill actually supports those fine ethics and efforts and the Hippocratic Oath, especially with the beneficence. There may always be, in an imperfect human context, those who might compromise or even be malicious to the better standards that we create as a society and culture. And sometimes it's important that we do so in law to set that guidepost. And this is one of those cases. When we've had 3 states, at least New York, Virginia, and Vermont, tell us that abortion is okay up to the point of birth, and who knows, maybe beyond, with their uncertainty of expression, we need to stand firm as a people of ethics and morals to stand against those things. This bill is a message that we have those standards, that we're going to support those standards, and that is not contrary or exclusive to the fine treatment and ethics that doctors and healthcare workers conduct. And the emotional testimonies are very moving and sorrowful, and they bring a tear. We're not looking at countering those real situations where a reasonable care and proper medical decision can be made, medically appropriate, as the bill states. But those decisions where otherwise there might be neglect. So I'm in support of this bill as a co-sponsor and ask that you make it ought to pass. Thank you very much.
Thank you, Representative. Next, we're going to, who's next? Trisha? Oh, Senator Gannon, do you have a question?
Yes, for the sponsor, Representative Walter Stapleton, if he's still there.
Yes, he is.
Okay, I'm having a hard time with the bill, Representative, and I possibly could even live with it, but I'm missing something where it says any born alive infant. I think it would be more acceptable to the other side, maybe a stronger bill if it said something like, if there is any chance of long-term survival or viability. I can't see myself ripping the child out of some of the testifying people's arms to give it medical care if it has no long-term survival or viability chances. Would that be something that you maybe could or address better than I just did?
Yes, can you hear me? Am I still on?
Yes, we can, Representative. We can hear you fine.
Thank you for the question. As a matter of fact, I did author a bill 622, which was retained on the viability, no abortion on the viability bill. This bill is designed, this one here is designed specifically against that abortion situation. Because we realize that the doctors do provide the care that they believe to be ethical and appropriate under a Hippocratic oath and the neonatal resuscitation program that was mentioned by Representative Smith before. All of those are admirable things. We're focused on the abuses that come out of abortion. We don't know the extent of abortions because we're not a non-reporting state along with 2 or 3 others in the United States to the CDC. So if we're not aware of the extent of abortion, how are we going to be aware of the extent of abuse that's possible? And that's what we're trying to focus on. And that's why there's a reporting function in this bill so that we can get beyond both obstacles to the correct care.
Thank you for taking my question.
Thank you.
Thank you.
Okay, who's next, Trisha?
We have Kelsey Mercurio.
Okay, let's put her through.
Hi, my name is Kelsey. I'm a student at the University of New Hampshire and a member of UNH Students for Life. I just wanted to start out by, I'm just so touched by all of the personal stories that people have shared, whether from the healthcare providers and also from the people who have personally experienced deep loss of a child. The text of the bill says that any healthcare provider present shall take all medically appropriate and reasonable actions to preserve the life and health of the born alive infant. To me, palliative care and compassionate treatment, but then also knowing when not to treat is part of medically appropriate and reasonable action. And I believe that phrasing does allow the flexibility for healthcare providers to and the families to recognize when a situation is like they're balancing like having those last final moments and having the greater chance of the child surviving. I agree though that this I am in support of the bill because it protects children who are born alive after abortion, and like previous people have said, because we have so little reporting of abortion statistics in New Hampshire, the circumstances where a child is born alive are not known. There are some examples that we do know of in New Hampshire and especially in other states, but is underreported. And I think we have an obligation to protect those children. And the bill is basically saying that those children should be given the same care as any other child that people have talked about today. And that I do want to share also that there have been examples of people who are abortion survivors and have grown up and eventually at some point find out that they that an abortion was attempted on their life and they survived. And for one of those people in particular, when she met her birth mother, that was an incredibly healing experience for both of them. And so there's a healing aspect going on here when a child who is scheduled for an abortion ends up surviving, and that parent meets them later in life. So I think I'm almost out of time, but thank you for letting me testify today.
Thank you very much for your testimony, Ms. Mercurio. Are there any questions from the committee? Okay, seeing none, thank you very much again. We have two more, Tricia.
Yes, there are three hands raised. Nancy D, you should be able to speak.
Hello, my name is Nancy Davis. Can you hear me?
Yes.
Yes, we can.
Yes. I understand the concern the doctors in hospitals have about emergency deliveries. However, Senator Gannon's suggestion to change the bill from born alive to with a reasonable chance of living, or however he put it, makes a lot of sense to me. Another suggestion that I would like to offer is this: could you amend the bill to only apply in situations where the intention was to perform an abortion? It seems like that would cover almost every case that we have heard in opposition to the bill.
Thank you very much for your testimony, Nancy. We will certainly take your suggestions into consideration. Are there any questions for Nancy? Okay, seeing none, thank you. Next.
Okay, we have Luke Lamar.
Hi, can you hear me?
Yes, we can.
My name is Dr. Luke Lamar. I'm a pediatrician at Dartmouth Hitchcock. I train here in residency. Thank you, committee members, for letting me speak briefly. I'd like to respect Senator Carson's request that we not repeat each other, and so I'd like to respond to a few specific claims made throughout this hearing. Specifically to Mr. Hewitt's claim that we cannot hold the idea that this bill does not intrude upon our relationship with our patients, but is also unnecessary. What I would say is that when we are in the decision of an infant who's born, there are reasonable options that we can take, reasonable options that we can't take. And I think this bill is vague enough to cause hesitancy while not directly stopping us from doing anything. I would say there are many things we could do that I would argue this bill wouldn't cover, but I think it's vague enough to be disruptive. And in response to Mr. Hennessy's reference to Dr. Gosnell, he was convicted on charges of first-degree murder, laws that already exist and did not need new laws written that I think only open the door to add vagueness and struggles for our care in these, as you've heard, very delicate situations. Our job as pediatricians is to alleviate suffering, and sometimes the care we provide will prolong suffering, and we know that. And it is a difficult conversation to have with families, but in these situations, we are not here to harm children. That is not our intent with things. And I think it is Senator Gannon, I can understand your sort of question about, could more specific language help with trying to find something more acceptable? But I think the idea that this is a bill designed to stop doctors from actively harming infants, I don't see that as a problem that exists. I see that there are sometimes times when we have to enter a palliative route, and that can be construed as harm, but is truly a patient-centered decision that we come to help alleviate suffering. Thank you for your time.
Thank you very much for your testimony, Dr. Lamar. Are there any questions from the committee? Okay, seeing none, thank you. Trisha, let's put through our last person who would like to speak.
Yes. Oops, I'm sorry, hold on. Althea? Okay, you're all set?
Can you guys hear me?
Yes.
Yes, we can.
All right, last but not least.
Thank you for hanging in there.
Thank you. So my name is Althea Anza. I'm a senior at the University of New Hampshire, and I'm the president of UNA Students for Life. And I wholeheartedly ask that you vote to pass for this bill. So reading the legislature in the bill, it says this: any born alive infant, including one in the course of an abortion, shall be treated as a legal person under the law of the state, with the same rights to medically appropriate and reasonable care and treatment. Also, any healthcare professional present at the time the infant is born shall take all immediate, medically appropriate, and reasonable actions to preserve the life and health of the born alive infant. All this act does is to preserve the life of the child who was meant to be snuffed out through abortion, make sure that this child has the same care as any other child that is born in any other circumstances. Hearing the stories of families who have lost their kids due to medical issues breaks my heart. And I give my sincere condolences to the families who have dealt with this. Hearing the stories made me think of how life is so precious, how life is so valuable, and how so many lives in New Hampshire who have died because of abortion also breaks my heart. We have no idea how many abortions are performed in New Hampshire because we are a non-reporting state. But I do know this: every life matters, and making sure that all babies, even ones that were meant to be killed, have appropriate medical care from powerful medical professionals doing their job correctly matters. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none. Okay, so we're going to go ahead and we are going to close the public hearing on House Bill 233, and the committee will be in recess until 20 after 3.
Trish, you can leave.
We have, hey, Jen, I don't know if you noticed, but we have a lot of the same speakers from the other bill are here as well. Okay. Okay. Well, we'll do the best we can to get through it all.
Rabbi Nafashi unfortunately had to go volunteer at the Friendly Kitchen, so she won't be able to testify anymore.
She won't be able. Is there a way that we can send her an email and ask her if she hasn't already submitted written testimony to ask her to?
Sorry, she already sent it to me just now, so I just added it.
Okay, terrific. That way we'll make sure that we hear from her.
Mhm.
Okay. Let me do this one. Okay. Okay, seeing that it is 3:20, the committee will come out of recess, and we're going to go ahead and open the public hearing on House Bill 625. Before I recognize the prime sponsor of the bill, Representative Folsom, I'd just like to give folks some guidance as we proceed through the bill. We have over 39 people that have signed up to speak on this bill. And we were supposed to be done by 4 o'clock. That is not going to happen. So we're going to try to move through the testimony and make sure that everyone who wanted to speak has an opportunity to be heard. We will again do the 3 minutes. So Ms. Malilo is going to go ahead and keep track of that time. I'm also going to ask folks that to please do not repeat testimony that we've already heard this afternoon. Please, we're interested in hearing new testimony. If you have written testimony, please do not read that testimony. We are not going to be executing this bill today. And so the committee will have plenty of time to read everything that we've been sent. Also, I would like to ask the medical personnel, the number of doctors that are going to be testifying today. Please don't repeat the testimony that we've already been given by other physicians. That was one thing I think that caused us to go way over time with the previous bill. So again, please keep all of these things in mind. And the goal is not to silence you, but to make sure that everyone has an opportunity to be heard this afternoon. Okay, so I am going to go ahead and call Representative Folsom to introduce the bill. Good afternoon, Representative Folsom.
Good afternoon, Chairwoman, and members of the Senate Committee. Thank you so much for letting me come here today to talk about the bill. It's kind of a shame that we have to get together to talk about things like this because New Hampshire, according to Planned Parenthood and other organizations, we're the most abortion-friendly state in the nation. And I'm not sure that that's a great badge to wear. And so basically what we decided to do is come up with a common sense, moderate bill, and hopefully bipartisan, prohibiting abortions performed on or after the 24th week. And the 24th week is important. We have a wonderful Republican trifecta here, which everybody thinks we would go crazy with super conservative stuff, but we can't even match states with a Democrat trifecta with regards to prohibitions on abortions. And we're not trying to totally eradicate abortions. We are just doing what actually was set out in Roe v. Wade. And that was very interesting to when you read about it. Roe v. Wade actually in their statement ruling, they rejected the view that a woman is entitled, quote, entitled to terminate her pregnancy at whatever time, in whatever way, and for whatever reason she alone chooses. And they also, in Roe v. Wade, spoke to 24 weeks as being a possible benchmark that they could use. Now, remember, that was a long time ago. Science has improved, and we probably could have tried to go for 20 weeks, but we are being moderate and going for the 24. I really want to encourage you to allow this to go through. It's very moderate, like I said, and right now the only abortions that aren't allowed is when a doctor is willing to basically kill a child on the way out at close to birth. So, you know, again, 24 weeks is not radical. It's what the Supreme Court said in Roe v. Wade. It's very common across the nation. And so I'm just going to encourage you to do that for us this week.
Okay, thank you very much, Representative. Are there any questions? Senator Gannon.
Just a few questions. Thank you for taking them, Representative. How many late-term abortions are performed after 24 weeks that you know of in New Hampshire? Are there any? Other than for medical reasons?
Okay, well, actually, I listened to the whole last hearing along with you folks, and it was said a couple of times in the last hearing that New Hampshire does not report abortions. And so as a result, we cannot give you a definitive answer, and I do not want to just guess.
Follow up?
Yes, follow up.
So your opponents, and it's not necessarily me, but they'll feel there's no exceptions for like a severely fatal abnormality. So if a woman at 24 weeks all of a sudden realizes her child, you know, there's no lung capacity, there's like unbelievable diminished brain capacity. Why don't you have some exception for a severely fatal, maybe it won't live abnormality outside the womb?
Well, there's a couple of things that I can say to that point. The first is if a woman thinks there might be because of a hereditary or a genetic issue, those testings are done very early in the pregnancy. And so they'll get that DNA testing done, which will show some of that. And then also, usually it's at 20 weeks that you're having an ultrasound. That's pretty much a standard across the board. And you will again be able to, the doctors can do a really good job of examining that child through ultrasound and knowing and seeing if there is a potential problem. And then the mother, the father, the parents, and the doctor can get together and say, they have 4 more weeks. Actually, some of those ultrasounds are done at 18 weeks. So they have 4 to 6 weeks in order to make that decision and to have that abortion before that 24-week mark.
Final follow-up?
Yes.
So if at 24 weeks, that's when it was detected, because I have had contact with women and doctors who have presented to me cases at 24 weeks where they find a severely fatal abnormality and the fetus is never going to have any long-term, like, beyond a few moments alive after a natural birth, would you allow for an exception for an abortion if they have a severely fatal abnormality?
Well, I'd like to say two things to that. The first is that there will be, I believe some of the witnesses will be speaking to that from a personal experience, were told that there was an abnormality and how they dealt with it. And then the other thing is I just sat and listened to the hearing about all of these parents who, even though their child was dying at birth and was going to die, how important it was for them to be able to hold that child, to have that child be baptized, to have that child, to be able, again, to comfort the child and see him in his last few days. And so after listening to those women, I'm probably even more firm in my decision to be firm with that 24-week mark.
Thank you for taking my questions, Representative.
Well, thank you.
Thank you very much for your testimony, Representative. Are there any more questions for the representative? Seeing none, I'm going to do something a little different because I've received a text message that one of the physicians who would like to testify really needs to get back to their patients. And so I'm going to call on Dr. Barry Smith.
Okay, Dr. Smith, could you raise your hand, please, if you are on the call? Oh, I got him. Okay, you should be all set to speak, Dr. Smith.
Thank you very much, Dr. Smith. Can you unmute yourself, please?
Okay, can you hear me now?
Yes, we can.
I'm sorry. I don't have to get back to patients. I want to say that I have to get back to a long way from here, but because I'm 83, and fortunately, for one reason or another, I've had 2 retirements already. I want to just make a couple comments. One, and I didn't get a chance in the last hearing to say, for sake of perspective, and it's in my written testimony, I have 2 adopted kids and 3 adopted grandkids. And so I'm not an abortionist, but I also trained in New York in the 60s where I watched women die who had illegal abortions, and the rich women went elsewhere and got legal, good abortions, and they lived. And I got very upset taking care of those patients who left kids without a mother. So that's part of what I've remembered for the whole practice life in the 50 years I've been up here. I've heard several times in the testimony about bad things in other states. That doesn't mean we're doing them in New Hampshire. This bill is looking for a problem to solve. Yes, we do collect the data, but to the best of my knowledge, because we all find out about these things, to the best of my knowledge, we do no elective terminations of pregnancy after viability. Viability is much more important than 24 weeks, which is a viability, and I've discussed this over the last few decades many times here, is a moving target. Every neonatal service has their own data. Every hospital really has their own data. So we use national data, obviously, in order to have reasonable discussions, and people play with the numbers. So for better or worse, as the women know, menstrual cycles are not always the perfect 28 days. And so to say a pregnancy is 24 weeks requires a little more than just looking at a calendar. In any event, I really think that I have to emphasize this: people who would be involved in these difficult cases in and around viability when things are found out that are significantly abnormal. And I was a little upset with the loose use that we go back to 20 weeks. Nobody's going back to 20 weeks that really wants to do anything fair. But these difficult decisions with difficult diagnosis that take time to work through with the family are the same 5 maternal and field docs that we have in the state of New Hampshire, which if you put, nobody keeps mentioning how hard it would be for a physician or a medical team to make decisions when there is a potential for going to jail. And that, it's a judgment call. They trained for 8 years beyond medical school, and it's still hard to make these decisions. And that's why, honestly, most of us feel very strongly that there shouldn't be laws that threaten or in any way make more difficult these medical tough decisions. There are ways to, if you find you've got a physician like that terrible situation that happened in Philadelphia, it's going to get taken care of, and it should be taken care of. Those are people who give us all a bad name. But I really and truly believe that you have to have a little more faith and trust. Our system, the way it's set up, with basically every obstetrical service in New Hampshire talking to each other, along with the ones in Vermont and many in Maine, we know what's going on, and we know who's doing what in a lot of ways. Yes, we don't have certain numbers that people have been trying to get, and I understand that as well. When I was running my department for the many 25 years I had people who were against any kind of abortion, and I had people who were happy to do it. And we got picketed many times, and sadly the doors are locked now to the Department of Obstetrics and Gynecology, which is sad. But
Senator Carson, that's 3 minutes.
That's 3 minutes. Oh, okay.
It goes fast, believe me, Dr. Smith, it goes very quickly.
I understand, and I just wanted to get the points out, because my position really is to protect the system of care for New Hampshire women and infants in the greater sense, and passing bills that have no problem in our state for the sake of passing them doesn't seem to me to make sense, because then when the unintended consequences become a real disaster.
Thank you very much for your testimony, Dr. Smith. Are there any questions? Seeing none, thank you very much.
Thank you.
Next, we're going to go back to the other senators and representatives. We will start with Senator Birdsall.
Okay. Not sure. She's not on the call.
Okay, all right, we will move on. We will go to Senator Perkins Quokka.
Okay. Senator Perkins Quokka, you're all set.
Yeah, good afternoon, Chairwoman and members of the Judiciary Committee. For the record, I'm Senator Rebecca Perkins Quokka from Senate District 21, representing the city of Portsmouth and surrounding towns. I'm here to speak in opposition to HB 625. In my mind, now is a time that we should really be expanding healthcare. It's an unprecedented time where our neighbors and friends are suffering. People are facing unprecedented housing and employment crises. And we don't need to be adding to that burden by further jeopardizing their healthcare rights. HB 625 seeks to ban abortions after 24 weeks with no exception for the health of the fetus, as Senator Gannon pointed out. There are medical conditions which occur after week 24 that are not known earlier in pregnancy. Pregnant people live in fear of those conditions because they can already see their baby as part of their family. Medical conditions that occur late in pregnancy are heartbreaking. The sponsor of this bill confessed to not knowing whether such abortions occur in the state. I suggest she attempt to further understand the reality of the ground here in New Hampshire before she attempts to bring legislation. Further, attempts to limit abortions are well known to have the collateral consequence of disproportionately impacting communities of color, members of the LGBTQ+ community, and low-income individuals. As a woman who was pregnant just over a year ago, it's a position of great vulnerability and a time of great care for the growing life inside of you. No pregnant person should face any barriers in making a difficult decision that may result from this significant condition. Please respect pregnant people and our medical professionals and leave the complexity of those decisions to private citizens and their advisors. Please vote ITL on this bill. Thank you.
Thank you very much, Senator. Are there any questions from the committee? Seeing none, thank you again.
Thank you.
Let's see, Ed, did Senator Birdsall sign in at all? Okay, there we go. Okay. Good afternoon, Senator.
Oh, Senator Birdsall, can you unmute?
got it. Sorry. I'm driving, so I accidentally hung up.
Oh.
I just want to, I'm just calling and in support of Senate Bill 625, and also just to let you know that there is an amendment. You all have received it. It's Amendment 0815S, and it's supposed to, it basically clarifies, tightens up the language a lot more. And again, I think hopefully Ian is still on the line and can kind of go through it, but it was meant to pretty much just tighten up the language and give it more clarity. So with that, I know you have a long list, so I'm gonna end my testimony.
Thank you very much, Senator. Are there any questions for the senator? Okay, seeing none. Okay, thank you. Next, we are going to go to Representative Stapleton.
Okay. Representative Stapleton, you can unmute now.
Thank you, Madam Chair and Judiciary Committee for letting me appear and speak. I am representative from Claremont. The state has a reasonable and legitimate interest in protecting and preserving human life, and is so stated in New Hampshire Constitution in Article 2, pertinent to natural rights, and even further evidenced in the existing New Hampshire state statute at RSA 329.41, Roman 1. Nothing herein is conveyed a right to abortion. In absence of a specific New Hampshire statute against abortion, the federal SCOTUS decisions prevail to extend it as a liberty, if not as a constitutional right, in opposition to the right to life in the 14th Amendment. So we should respect and protect life to have a standard to assert right to life and the state's interest in that regard. 625 utilizes the viability standard in Casey, but with a focal 24 weeks gestation demarcation, even though viability ranges under today's medical advances to anywhere between 18 to 28 weeks. So to set a workable standard for the larger aspect of it. With now over 62 million abortions in the United States since 1973, out of a current population of 230 million now, we have a problem. That is a terrible wanton waste of humanity in abortion. Please OTP this bill as a reasonable compromise standard to protect life and recognize the avenue of choice currently afforded under the federal decisions. Please pass this bill. Thank you.
Thank you, Representative. Are there any questions for the representative, Senator Gannon?
Thank you. Same question I keep going to, and I have a problem. It's a bridge too far without it for me, sir. You don't have any exception for severely fatal abnormalities, which I think would be cruel to a mother and father in the situation. Why can't you give me an exception?
I think that the viability standard comes into play there, and an exception wouldn't hurt.
Okay, so you'd be open to if there's a viability for the fetus standard.
Right, yeah, I mean, this is what this is all about, for those type of situations to be factored in.
Which is not in the existing amendment, is it? Am I missing it?
I haven't seen the amendment that Senator Birdsell mentioned, so
Okay.
I can't comment on that at this point.
Okay, thank you.
Okay, are there any further questions for the representative? Okay, seeing none, thank you. Next, we are going to go to Representative Marjorie Smith.
Hey, Representative, you're all set.
Thank you very much. Thank you, Madam Chair. I'm Marjorie Smith. I represent Durham and Madbury, which I've done for 25 years. And Madam Chair, as you know, and as Senator French knows, I do not pay much attention to party lines. I care about policy, and the politics I don't have much patience for. But Senator Carson, I was shocked, and you wouldn't think I'd be shocked after all these years, to hear the prime sponsor of this bill use a phrase trifecta. At first, I thought she was talking about charitable racing or something else about gambling. And then I realized she meant that the House and the Senate and the governorship are all in the control of the Republican Party. And it shocked me that she would consider that relevant to the discussion of this bill. This bill has nothing to do with politics, nothing at all to do with politics. It has to do with women who are your mothers, your sisters, your aunts, your cousins, your children, your grandchildren, who are trying to produce children to raise in their families. It has nothing to do with politics. And yet, when you look at this bill, this is a little different from the previous bill. In the previous bill, it was a Class A felony. In this bill, it's a Class B felony for a medical professional to do what the medical professional thinks to do is right. In this bill, there is so little regard for the pregnant woman. She is so obviously thought of as a vessel to produce a child that there isn't even an exception for rape or incest. That is pretty shocking. There is also in this bill a requirement of invasive and expensive tests, and people who are pregnant, women who are pregnant and who may or may not have difficulties, do not necessarily limit those difficulties to whether or not they have enough financial resources to pay for expensive and invasive tests. So I will not go on any longer. I am shocked by the transparency of considering this a political bill rather than something that affects the well-being of women and their families in this state. The exceptions are narrow. The viability is something that really isn't determined until after the fetus has been born. I guess that's the right word. There are criminal penalties here again for medical professionals working to do the right thing. And I would hope that you would support the House Judiciary Committee's position of ITL. Thank you very much, Senator. And I apologize for sounding so disturbed, but it's because I am so disturbed.
Okay, thank you very much, Representative Smith. I was going to ask you what House Judiciary had to say about it. So thank you for preempting my question. Senator Whitley has a question for you.
Thank you, Madam Chair, and thank you, Representative Smith. I don't think you ever need to apologize for expressing outrage at something that you find outrageous. So I'm wondering if you, based on your tenure in the New Hampshire legislature, if you could share whether you've ever seen a bill like this with such limited exceptions come over to the Senate.
I do not believe I have ever seen a bill like this come over to the Senate. When I joined the legislature in 1990, after the 1996 election, when there hadn't been Democrat in majority since the Civil War, people asked, why would I do it? And one of the reasons was because then this state was a libertarian state in the historical sense of the word, in which the government believed that they shouldn't be invading the private lives of its citizens. And so with a constantly Republican leadership, we, in all those years, have had only one bill in the area of reproductive rights that in fact made it through the whole process. I think you know what happened in this bill, and we could chalk it down to COVID. It's just one more, these two bills, one more sad effect of COVID. Ordinarily, this bill would not have gotten out of the House. And now you all have to deal with it. And because I know and respect so many of you, I know that you will give it very serious thought and recognize what's at stake here in this legislation.
Thank you.
Are there any further questions for Representative Smith? Okay, seeing none. Thank you very much, Representative.
Thank you, Madam Chair. It's always a pleasure to see you.
It's always a pleasure to see you as well. Next, we're going to hear from Representative Amanda Toll.
Okay. Representative Toll, you're all set?
Dear honorable members of the Senate Judiciary Committee, my name is Amanda Elizabeth Toll and I represent Cheshire 16. I believe that the vast majority of Granite Staters, regardless of political party affiliation, oppose restrictions on reproductive rights. I got elected on a reproductive justice platform. I am a firm believer that all people, regardless of race, economic status, gender, and sexual orientation, have the right to end a pregnancy if they decide that is the best option for them. It is important to note that for many pregnant people, the decision of whether or not to terminate a late pregnancy is not about whether or not they want to have a child. Often it is about the safety of the pregnant person or the overwhelming medical needs of the fetus for whom they want to provide compassionate care. The decision to terminate a later term pregnancy can be an anguishing one. The state getting involved will only make a hard decision even more traumatic. When people do have children, they are entitled to raise them in safe, healthy environments with the resources they need, including access to healthcare, housing, and education. If you want to be pro-life, providing these social services is the best way to do it. The anti-choice bills in front of you today are simply inflammatory and misleading and are meant to erode access to reproductive health care. They are not pro-life. Quite to the contrary, they will harm pregnant people and their healthcare providers. I urge you to oppose both HB 233 and HB 625. Thank you for taking the time to hear my testimony. I will be deferring questions to the medical experts on at the hearing today.
Thank you very much for your testimony this afternoon, Representative. Next, we will go to Representative Timothy Horrigan.
Good. I hope I'm muted. Can you hear me? So I'm Representative.
Yes, we can hear you.
Great. I'm Representative Timothy Horrigan. I represent Stratford County District 6, the towns of Durham and Madbury, the same district that Resident Marjorie Smith, who spoke so eloquently a few minutes ago, represents. And I'm also on the House Judiciary Committee. So we had a bipartisan majority voted ITL in the Judiciary Committee, and then the full House took the opposite decision. It was not totally partisan, although there weren't that many surprises, but there were several Republicans who crossed over and voted against it. There were a couple of Democrats who crossed the other way. So that's probably as it should be. First, so this is a bad bill. It's very restrictive. We're throwing around 24 weeks as the threshold for viability, but that's even with all the modern technology, the fetus that is born at 24 weeks still only has about a 50% chance of living. Which brings me to one objections bill. The prime sponsor is talking about how you can get an ultrasound at 18 weeks and all these wonderful things. And then before your baby is born and afterwards, it makes a big difference whether or not all that wonderful medical technology is in fact available to you. So here in New Hampshire, if you live in if you live in a poor community, if you live in a rural community, if you're a person of color, if you're young, you have a lot less access, a lot less resources than what the rest of us take for granted. So you may not necessarily be able to get an ultrasound at 18 weeks. You may not exactly have a neonatal specialist who you can talk to, who you can trust to counsel you through the whole thing. So all those, there's just a lot of assumptions in the prime sponsor's testimony that don't apply to everyone. And she's a first-term rep, so hopefully she'll be working on those issues, access to healthcare with other legislation. So I really don't know her till now. The partisan trifecta thing, I agree with Representative Smith. That was an unfortunate thing to say, but first-term reps or even seven-term reps like me sometimes get carried away and say silly things. So I'll accept it as that. So I think this is, so 24 weeks, even 24 weeks, even though it's not as extreme as the 20 or 18 weeks we've seen in other bills, it's still, that's a very restrictive threshold after which you've no right to an abortion at all, except in extreme cases, because there are still many, and I'm sort of presumptuous of me to tell women what they should or shouldn't do with their body, because I'm a man, so this debate about abortion would be very different if men could get pregnant, especially men in their 60s like myself. So that's I just don't feel like we should be telling women what to do body. Every pregnancy is different, so not every women's pregnancy feels the same at 24 weeks as someone else's. So they should be able to make the decision that's best for them. There's like a small factual thing, and I'm not sure whether Representative Stapleton really misspoke, but he said the population of the United States was 230 million. It is in fact 330 million. So that's 40 years. That figure's 40 years out of date, and it is going up even with the pandemic. So that's so is my time up, or I still have a minute?
Yes.
No, your time's up.
Okay.
Well,
so I don't get a chance to mention the fact that this RSA is in the wrong part of the law books too. It's like it's in a title chapter of the law book that's about professional licensure. So it should be 100 RSAs. Should be like 200 RSAs earlier, where the bills about medicine are, and there are other. And this definition of abortion, it's different from the abortion we find elsewhere in the RSAs, but it's the same as that in similar bills have been in other states. So thanks for your patience, and that's what I have to say. Thanks.
Thank you, Representative. Next, we're going to go to Representative Rebecca McBeath.
Okay. Representative?
Yes, thank you. Good afternoon, Chair Carson. Thank you so much for having me. And I see my friends and colleagues. When I see Senator French and Senator Gannon, who were my House classmates, I always feel like an underachiever, but I'm grateful to be here. And, this is actually, I'll be very brief as I was before. I mean, this is such a personal issue, and it's just really unimaginable to create all the scenarios with which a termination of a pregnancy at 24 weeks or beyond might be necessary, and none of them are happy incidents. I want to just remind you, we license beauticians, electricians, attorneys, physicians, fire marshals, accident reconstructionists, and we trust them. We trust them to make the decisions. We're not pulling out, one category of what they might perform. So I just, I am a parent, and I just ask you all to let's trust our licensing systems. Let's trust the ethics and the boards that regulate these people, and let's move forward and let what's a private, difficult decision to be remain between a family and their healthcare providers. Thank you so much, and I appreciate your time this afternoon. Thank you, Senator Carson.
Thank you, Representative. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to go to Senator Hood.
Okay. I do not see him on the list.
Okay. All right. Before we get started with going through the list, I'm going to remind everyone again about the 3 minutes because we want to make sure everyone has an opportunity to testify. And I would also like to ask you if you have written testimony, please do not read it. And finally, for all the medical personnel that are have signed up to speak, please do not repeat the testimony that we have already heard. Just please try to give us something different or new or something that we have not heard before. Okay, we're going to start with Valerie Vallant.
Okay, and Senator Carson, I do see a number with their hand raised. I don't know if that might be Senator Hood. Did you want me to check?
Yeah, why don't we check and see if that's Senator Hood?
Is this Senator Hood on the phone?
Yes, hello, thank you. I'm sorry, I moved from Zoom to my vehicle, so I'm calling in. Thank you, Madam Chair and members of the committee. For the record, my name is Matthew Hood. I'm the Vice President of Government Relations at Dartmouth Hitchcock. I will be brief. I will be reiterating largely my testimony from the previous bill, which is that in light of provider testimony that you will hear with respect to parameters around care decisions between a patient and their provider, we have concerns with the criminal penalties. I believe it's a class B felony in this situation. It was a class A in the previous, as well as civil and monetary penalties. So thank you, Madam Chair.
Thank you very much, Senator. Are there any questions? Okay, seeing none, thank you. Next, we're going to go to Valerie Vallant.
Okay. Hi again, Senators. Thank you so much for hearing my testimony again. To repeat, my name is Dr. Valerie Vallant, and I am an OBGYN resident physician, one of the chief residents here at Dartmouth Hitchcock, although I am here upon my own accord. I am also working next year in Concord, New Hampshire, and have very strong ties to New Hampshire, which I'm excited to continue. I'm here testifying in strong opposition of HB 625. Specifically, the things I want to address is that viability is not an age, it is a physical state, and it's only able to be determined upon birth by medical professionals, such as OBGYN physicians, such as neonatologists. Putting an abortion ban on an age completely disrupts the medical system. I completely support what Representatives Marjorie Smith and Rebecca Macbeth have said. Abortion is, in this setting, being proposed as political. However, it is not political. It is a medical decision. It's a personal decision that is made between a patient and provider under unique circumstances, whatever they may be. And putting it in this political realm takes that away from the medical world and puts it in the hands of politicians, which is something I strongly believe, again, is not even kind of appropriate is the word I will suppose I use. Every pregnancy is different. Every circumstance is different. It is impossible to kind of put a definition on it. Again, that is kind of my opposition in it. I'm happy to answer any questions.
Thank you very much for your testimony this afternoon. Senator Whitley has a question.
Thank you, Madam Chair, and thank you, Dr. Vallant, for sticking with us and providing testimony on this bill also. So I'm interested in your thoughts about whether this, we did hear testimony about how, the fact that these situations are uncommon, but when they do occur, they are the result of, they involve very difficult situations. So I'm wondering if you have thoughts about, or you have any concerns about the passage of this bill. Would it make it more difficult for you and other providers to navigate these complex situations with individuals?
Yeah, thank you, Senator Whitley. I think you hit the nail right on the head there. I think in part it is, we already have strict standards for termination or abortion care in terms of counseling and then kind of moving forward with patients. And I think if stricter restrictions go into place, not only would it
lengthen the time between, for example, we brought up, fatal fetal diagnosis. It would lengthen the time between fetal diagnosis and the ability to then move forward, which would again increase the age that potentially, if that is the big concern, the gestational age of the fetus in the situation, again, with kind of the clinical decision making being made. It would put numerous not only restrictions for healthcare providers, but also, increased kind of time, effort, finances, things that are just unnecessary because, again, the way we are currently providing care is of best kind of medical interest based upon a clinical situation.
Thank you.
Thank you. Thank you.
Are there any further questions? Okay, seeing none, thank you very much.
Thank you so much. Have a great afternoon.
You too. Next, we're going to go to Maris Toland.
Okay. Sorry. Hang on. Dr. Toland? Okay.
Hello again, Honorable Committee. Thank you for allowing my testimony today. I'd like to just thank Senator Perkins-Coca, Dr. Barry Smith, and Representative McMeeth for the points that they've made, and I am not going to echo what they've said, but I'd like to make several comments. One is I'd like to medically correct a comment that Representative Folsom said discussing genetic testing regarding when that happens and when that's available for women. She did mention that, women are able to have genetic testing and diagnose fatal fetal diagnoses early in pregnancy. It is true that there are several forms of genetic testing that can happen early in pregnancy, particularly in the first trimester. However, they do not capture all fetal diagnoses that are either fatal or debilitating. There are several rarer diagnoses that cannot be determined until much later in pregnancy, sometimes not even by 24 weeks. Additionally, just a comment about ultrasound. Ultrasound is a fantastic technology which shows us many things about fetuses while they're inside. However, it is not without fault, and ultrasound cannot diagnose every problem. So I just wanted to comment there on a little bit of medical ambiguity. This is not a black and white picture, and it's not something that all women really are able to determine early in their pregnancy. I'd just like to make a comment as well that based on numbers from the CDC in 2019, only about 1.3% of abortions are performed after 21 weeks. There are several reasons that women might seek abortion later in pregnancy, and many of those include poor access to care, lack of resources, honestly, lack of obstetrical care and access to ultrasound, as well as we mentioned, the inability to diagnose all fetal diagnoses earlier in pregnancy. So there's several reasons why things can not become apparent until later in care. And then the last comment that I'd like to make is that as a healthcare provider, it is frustrating to have criminal penalties against the providers themselves. And certainly as a resident physician here in New Hampshire who is starting to look for where I want to practice, I do pay attention to different both political landscapes as well as legal landscapes in different states. What is the malpractice insurance like? What is the political landscape? Is there going to be a lot more sort of legal and potentially political difficulties to where I practice? To be perfectly honest, there are a lot of issues in the healthcare system, not even just surrounding abortion care, but how the system works, and adding additional barriers to providers will make it more challenging to attract new physicians to this state, and I find that problematic. Thank you so much for hearing my testimony today. I do appreciate it. I'll submit some written testimony as well.
Thank you very much for your testimony, Dr. Toland. Are there any questions? Okay, seeing none, thank you. Next, we're going to go to Ilana Cass.
Okay. Ilana?
Thank you very much to the committee. I would briefly remind the committee members, we have heard from various representatives and senators 3 different gestational age cutoffs as to what defines viability. The 2 points that I would make, number one, this is obviously science that is best left in the realm of physicians. And number two underscores the fact that viability, you cannot ascribe a specific gestational age. And as discussed, I would submit to you that viability is really depends upon, to some extent, the pregnancy, the patient, and how the pregnancy is progressing. So to hang a specific gestational age on prohibiting abortion services is not only problematic, but it is not scientifically valid. Further, I would state that not only you've heard from some of the trainees in our program here at Dartmouth. Again, sorry, I am the chair of obstetrics and gynecology at Dartmouth Hitchcock in Lebanon, and I've taken care of women for over 30 years. But I would submit to you that continuing to have a vibrant, well-trained complement of physicians to serve the women and families of New Hampshire really requires, especially in these difficult times with COVID and the obstetrics and gynecology care deserts that we are starting to see emerge in this rural landscape. We really need to empower physicians to be well-trained, to use science, and to really hold very, very wholly the relationship between a provider and a patient when making these difficult decisions with respect to the decision to terminate a pregnancy. I'm happy to take any additional questions.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Senator Whitley.
Thank you, Madam Chair, and thank you, Dr. Cass, for your many years of service and for sticking with us again today. So you provided testimony on the obstetric care deserts in New Hampshire and that they are, really those deserts are in our rural communities. And we also heard testimony about how the lack of obstetric care is one factor that might lead an individual to need an abortion late in pregnancy. And so I'm curious whether you think if this bill passed, would it be harder for you to recruit and retain medical professionals to come to New Hampshire to provide that much needed obstetric care?
Thank you very much for your question, Senator Whitley, and I think that is absolutely the case. It will be harder to recruit trainees to our program in New Hampshire. It will be harder to retain those trainees once they have completed their training. And I would remind the committee again that we know from the data since 2000, 1/3 of the New Hampshire hospitals have closed their labor and delivery units in our state. That does not factor in the financial difficulties of COVID. So not only would this hurt our ability to train and retain these providers, but consider the impact this will have on our citizens when they will have to have fewer and fewer locations for care with fewer and fewer trained individuals who can give them the appropriate level of care. This actually threatens the well-being of the citizens of New Hampshire. Legislation like this, in my opinion, really makes it much more difficult to adequately care for our population.
Thank you.
Okay. Are there any further questions? Senator Khan.
Thank you, Madam Chair. And Dr. Cass, again, respect your position that you hold in our state. So medical ethicists and the teaching of ethics in medical school, I mean, this is one of the most important things that I think physician training is about. That's what physicians have told me. And we've got professional boards that regulate this. So can you just reflect on the fact that this is well regulated within the profession?
Certainly I can. Thank you, Senator Khan. And yes, I would echo those sentiments. Absolutely, that ethics is a foundational discipline within the training of our medical students as well as our residents. Moreover, we do not discontinue viable pregnancies that are normal in the state of New Hampshire and in the medical field. We don't do that. We are talking very specifically with the reason that I oppose this bill so strongly and so passionately is there are unfortunately certain fatal conditions that threaten the health of the mother or the fetus that cannot be discovered, will not be discovered until later on in the gestational age. And it is at that point, under those incredibly rare but incredibly challenging and tragic circumstances, it is the fundamental tenet of medicine that a physician and the family, the mother and the family of that, in that particular pregnant scenario, enter into a very important and very sacred discussion of options and an ethical guidance with regards to the best options for the preservation of life and liberty. And that is not something that should be legislated by politicians and legislators. That has no role in making these incredibly difficult and very tragic, rare decisions.
Thank you.
Are there any further questions? Okay, seeing none, thank you very much for your testimony. Next, we're going to go to Susan Bartlett.
Ms. Bartlett, you should be able to unmute yourself.
Yes, can you hear me?
Yes.
Okay. Yes, I'm Susan Bartlett, a semi-retired high-risk obstetric nurse. I have dealt with these problems for many, many years. I've held women in my arms as they have gone through these devastating consequences. This bill would force women and their families to continue a pregnancy even when the fetus will have a devastating outcome. I will talk about one issue that is not small. This is a matter where the woman and her family are already grieving, and to be forced to carry a fetus incompatible with life or that has significant, profound morbidity for perhaps up to 12 more weeks after 24 weeks is incomprehensible to those who have never supported women and their families or experienced it themselves. And one problem here that that the other professionals may not have been speaking about, but that I have been able to observe, many women experience this anguish, also have infertility problems, and they're at the end of their reproductive years, or they've already experienced many problems. Any time lost by being forced to continue a pregnancy with a fetus that has any one of a number of fatal syndromes decreases their chances to be able to carry a healthy pregnancy to term, and only truly exponentially adds to the grief and anxiety of their situation. These are real situations. I've witnessed them at least over 100 times in my career. And this is just another bill where legislation comes between the woman and her provider. And I just want to say that I am very strongly against this bill. And I'm happy to take questions.
Thank you very much for your testimony. Are there any questions? Okay, seeing none, thank you. Next, we're going to go to Mary Lou Ciolfi.
Yeah.
Okay.
Okay. Mary Lou, you should be all set to unmute.
Thank you, Madam Chairwoman and members of the committee. My name is Mary Lou Ciolfi. I'm an attorney currently working as an academic researcher. So I'm in Bath, Maine, but I consider myself a resident of New Hampshire. I grew up there. My extended family is there. I have long roots there. But I come before you today in strong opposition to this bill and with a personal story of my own about a late-term abortion in 1992. I have submitted written testimony, so I'm not going to repeat the details of my experience, but I just wanted to emphasize a couple of things about the timeline and trajectory of what I knew. So I had a first amniocentesis at 13 weeks of pregnancy, and I got a call a couple of weeks later saying that they didn't get enough fluid. So I had to come back and repeat that amniocentesis. By then it was around 18 weeks. It was a couple more weeks until I finally got the devastating results of that amniocentesis. And then of course there were terrible phone calls with my obstetrician, just clamoring for information. She was connected me with a geneticist. Now, remember, this is 1992, so we didn't have a ton of information available. So I had to go to Scarborough, Maine. It just was, and I was married to a lawyer. I am a lawyer. I was married to a lawyer. I wanted this child desperately. So we were doing things as quickly as we could. But even so, it took time. So around 21 or 22 weeks, my husband and I finally decided we were going to terminate this pregnancy. My obstetrician said there's only 2 doctors in the entire state of Maine who were able to perform a second trimester abortion. It took time to get that doctor, schedule it. And by the time the procedure happened, it was 24 weeks. Again, we were trying to digest a lot of health information, a lot of scientific information to truly understand what the risk was to me, what the risk was to my unborn child. It was a terrible time. Obviously we didn't make this decision lightly. We wanted to understand those risks. It was a thoughtful, deliberative process. And with my providers, with my family, I mostly want you to know that as I reflect again on this period of time in my life in preparation for this testimony, I'm absolutely reliving the sadness and the tragedy of that decision. It was a horrible time. I feel, however, like just immense gratitude for the compassion and understanding that was extended by my doctors and my medical team, by my family, from my very Catholic parents who were anti-abortion but understood completely what I was trying to do for my family. But mostly I want to extend gratitude for the privacy and freedoms that were extended by my government. For all of the pregnant persons and families in New Hampshire and elsewhere who might face this sort of devastating health news as I did, I urge you to protect our reproductive rights and our personal and private decision makings in the medical arena. Thank you very much for your time.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Okay, seeing none, again, thank you. Next, we're going to go to Dr. Young.
Dr. Young?
Can you hear me?
Yes, we can.
I want to thank you again for allowing me to testify before you. I'm here to speak strongly in opposition to House Bill 625. My name's Dr. Og Young. I will forego any further introduction, assuming all of you heard who I am during my prior testimony. I am here to represent the New Hampshire Medical Society and the New Hampshire State Chapter of the American College of OBGYN. First off, I want to say that House Bill 625 would ban abortions at or after 24 weeks, with rare exception to life-threatening maternal complication of pregnancy. I want you to know that in the absence of any state statute, there are no elective abortions in New Hampshire at or after 24 weeks in normal pregnancies. I want to be clear that to my knowledge, no one in this state provides terminations of pregnancy after 24 weeks in cases of apparent healthy babies. What's important to understand is that obstetricians in New Hampshire do offer to women the opportunity to terminate pregnancies after 24 weeks in cases of fatal fetal diagnosis. Whether it's anencephaly, agenetic kidneys, no kidneys, in the absence of an abdominal wall, an omphalocele, skeletal dysplasia. These are diagnoses where babies are not going to survive. And obstetricians do offer women carrying pregnancies with these congenital anomalies a chance to terminate this pregnancy early. These are uncommon, but not rare. In these situations, a woman and her physician, believe me, I've been with women in this situation, decide together to induce early labor, delivering her wanted but abnormal pregnancy after 24 weeks gestation. No woman should be made to carry her baby with congenital anomalies to term because she's past 24 weeks. No law should enter into this private decision made by her and her physician. If House Bill 625 becomes law, once more obstetricians could be charged with a serious crime when acting in the best interest of a woman doing what she can best live with. Every pregnancy is unique. Every woman is unique. Every circumstance is unique. It should be left to physicians and their patients to decide the care that is most appropriate, not legislators.
Excuse me, Senator Carson, that's 3 minutes.
Okay.
This bill makes no sense. We do not need to restrict termination of pregnancy at 24 weeks. The law would deny women her private decision to terminate an abnormal pregnancy. And finally, this statute would threaten physicians wanting to provide safe, thoughtful, and compassionate care. I strongly urge you to oppose House Bill 625. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Senator Gannon.
Hi, Doctor. How you doing? Quick question. If we put in the exception for severely fatal abnormalities, we would just be codifying what you guys are already doing. So that might give a lot of people peace of mind, and it wouldn't really change anything. Your practice techniques.
Actually, I was going to say about your questions early on, you really hit the nail on the head for me. This termination of pregnancy after 24 weeks should certainly be allowed in a woman carrying an abnormal pregnancy. As other people pointed out, it's hard to pick a gestational age to ban abortion because it is a moving target and dates are not always accurate. So I hesitate to make this a law, especially when we don't have any physicians performing abortions after this gestational age in normal pregnancies.
Thanks.
Okay, are there any further questions? Seeing none, thank you very much.
Thank you.
Next, we're going to go to Jill Arabas.
Ms. Arabas, if you're on the call or on the Zoom, could you please raise your hand? I don't see her.
Okay, next we'll move on. Next, we're going to go to Kelly 9.
Okay. Kelly, go ahead.
All right, can you hear me? Okay, I see somebody nodding, so I hope that means yes. Well, good afternoon. I'm Kelly 9. I live here in Bedford, New Hampshire, and I thank you for your attention and the opportunity to share my support for House Bill 625 regarding the protection of fetal life. As I mentioned, my name is Kelly. I'm 29 years old. I lived in Washington, D.C. for the last 5 years before moving back to New Hampshire this summer, where I was raised. During my time in one of the nation's most progressive cities, I received my MBA from Georgetown University, and now I work for a leading tech company. All statistical data, including my being a woman, suggests I should be here today advocating against this bill, claiming my right to privacy, my right to do what I please with my body, and my reproductive rights. But I'm not here to do that. I'm here to do the opposite. The arguments for abortive rights get more sophisticated and complex with time. This alone should cause us to pause because the truth is always simple. Yes, the application of truth does require immense wisdom and discernment, but the principles are simple, and we cannot deviate from them and still expect society to flourish. Today, the simple truth is that life in the womb is just that, life. And life is always precious and worthy of protection. HB 625 protects the precious life of both the preborn and the mother. One particular argument that we've heard a lot of today in favor of abortive rights after 24 weeks is over fetal anomalies. This argument requires the belief that life is only worth living if it will be free from suffering. Suffering for a child who has the possibility of a disability, and suffering for the parent whose own life could be greatly impacted by a disabled child. Well, as the proud older sister of a brother with immense cognitive and physical disabilities, I fully disagree with this premise. The truth is, we all inconvenience each other, and there is only one possible life for all of us, a hard life. We all suffer. Life unfolds unexpectedly for all of us, but it can still be truly beautiful if we realize another simple truth, that life is indeed meant to be lived sacrificially for others. So I'm not here to claim rights for myself. My parents have beautifully lived out their conviction that life is well lived and full of joy when you stay lockstep with the simple truth that life is precious and worthy of protection no matter the sacrifice. I do envy your position and your ability to stand as protectors of the simple truth with your vote standing for life in the womb. I fully support HB 625 and would ask that you do the same. Thank you for listening.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Okay, seeing none, thank you again. Next, we're going to hear from Sarah Connors.
Okay. And I believe this is Sarah Connors.
Yes, this is she.
Okay.
Okay, got you this time. So I'm going to do this quick again because there's, again, just real quick, the doctor, Ogi Young, was talking about omphaloceles. My daughter had an omphalocele, and the survival rate for a baby with an omphalocele that's isolated is 90%. It's 70% for a child with an omphalocele with an additional defect. Jamie Herrera Butler also has a child with bilateral agenesis who is surviving and alive. I think she's about 6 years old. When we cut off the ability for doctors to treat children, or if we decide that we're not going to treat these children, we lose the ability to experience miracles. Okay, that's what we're doing here. In my own case, I found I had my daughter before the New York Reproductive Health Act was passed. I've counseled women for the last 10 years on this, and what we have seen since the New York Reproductive Health Act has passed has been enormous pressure against women to terminate pregnancies where there is moderate defects like Down syndrome, if the women are poor or underprivileged in some way, because it turns into a significant health issue at that point when these are not fatal disabilities. Okay, so again, there is no reason that, you know, I understand that doctors are compassionate and caring, but they're real people and they have normal feelings just like the rest of us, and biases, and, you know, their experience, you know, speaks to them of different things, but they're not always right about everything. And we're denying children possibly the ability to live a life that can be full and, you know, joyful with their parents and to their abilities, and not the ability that our ableism thinks is what a life should be lived. And I don't want to go over my 3 minutes again. So I'm trying to cut it short, but I do have more. And Senator Gannon, I'm actually going to be sending you a particular email separate on some of the things that you brought up, because I know you're concerned about this a little more, about statistics and mental health with women who carry to term versus those who have terminate pregnancies. And I think you're going to be shocked when you see what they have to say.
Okay, thank you very much for your testimony, Sarah. In fact, why don't you send that to all of us, because I think we all would be very interested in
definitely
in reading what you have to say.
Well, I had a separate, just a regular general email that I was going to send, but I wanted to particularly address, because I totally understand his concerns, because I was pro-choice before all this happened to me.
Okay, well, as I said, I think we would all be interested in seeing the information that you have. So please send it to us all.
Okay, thank you so much, guys.
Thank you, Sarah.
You're welcome.
Okay, next we're going to hear from Shannon McGinley.
Okay.
Great, can you hear me?
Yes, we can.
Wonderful, thank you. This afternoon, Senator Gannon has brought up fetal anomalies a couple of times, and I want to provide an alternative view to that, of allowing for the proactive killing of the baby, as he suggests, versus letting nature take its course. I'd like to share a story of my matron of honor in my wedding, Lorraine, and her baby Cecilia, who died shortly after birth at 40 weeks gestation. Cecilia had a lethal skeletal mutation where the rib cage is too small, and when the baby attempts to breathe her first breath with her own lungs, she'll suffocate. Cecilia was diagnosed at the routine 18 to 20 week ultrasound. According to a number of the physicians, including Cecilia's dad, Chad, who happens to be the head of the OBGYN department at a hospital in New York, and says that 18 to 20 weeks is the typical gestational age to learn of fetal abnormalities, if not sooner. Lorraine and Chad had chose to carry Cecilia to term. She lived for a couple of hours, enough time for her to be baptized, have photos of her held by her older brothers and parents, and to say their goodbyes. It was a beautiful death timed by our Creator. I had the honor of attending Cecilia's funeral. Her life and her death touched many people, and the way her family handled her life and death was an inspiration to many. Now for my story. Doctors can misdiagnose. In 2015, here in New Hampshire, at my routine 18-week ultrasound with my last pregnancy, a concern was raised about the development of my son, Aiden. Days later, I was sent for a level 2 ultrasound. There, he was diagnosed with a developmental anomaly that, although not life-threatening, if properly managed with lifelong medication, he would have a physical deformation. The physician gave us various options, including the termination of pregnancy, or abortion is another way to say it. My husband and I chose to pursue a second opinion, and we went down to Boston Children's Hospital for additional testing, including an MRI. A team of doctors made up of geneticists and endocrinologists, urologists, among others, consulted with each other, and they even met with us all to determine what we had was a totally normal, healthy baby boy. They didn't understand the reason behind the diagnosis from the doctor associated with the well-known hospital here in New Hampshire. We, of course, wouldn't know for sure if he was normal, though, until he was born. And sure enough, he was totally normal. Not a single thing was, quote, wrong with him. Doctors are human, so they make mistakes too. I often wonder what would have happened to Aiden if he had been carried by a different mother who wouldn't have sought out cumbersome and expensive second opinion. Would he have been the victim of a, quote, therapeutic abortion? I'm grateful that we have Aiden here, and so are his 4 older brothers who dote on him. I also just want to follow up with a comment that was made by Dr. Young. He said that abortions in the absence of fetal anomaly do not happen here in New Hampshire, but I don't understand how he can say that when we don't collect abortion statistics here in New Hampshire. I would also just add that talking about a fatal fetal diagnosis, there's a spectrum there too. And where does one draw the line in terms of what that disability might be to determine who lives and who dies? Thank you. That's all of my testimony. If you have any questions, let me know.
Thank you very much for your testimony, Mrs. McGinley. Are there any questions? Okay, seeing none, thank you. Next, we're going to hear from Bob Dunn.
Okay, Mr. Dunn.
Okay, thank you. Good afternoon, everyone. It's good to see all of you. I'm Bob Dunn, the Director of Public Policy for the Roman Catholic Diocese of Manchester. And on behalf of Bishop Peter Labashi, I want to register our strong support for House Bill 625. I've submitted written testimony, and I know you've had a long afternoon, and I won't go through all of that or repeat anything that we've already heard. I just want to say this. I think we need to think about how these sorts of bills, as difficult as they are, undeniably, how these sorts of bills resonate in other areas. If we want society to respect and value the child who is a refugee, or the child who is homeless, or the child who doesn't have access to health care, a child who is in any way voiceless, then I think it's essential that we respect and value the child in the womb as well. And House Bill 625 does that. So I respectfully ask you to vote ought to pass on the bill. Thank you.
Okay, thank you very much for your testimony this afternoon, Mr. Dunn. Are there any questions from the committee? Okay, seeing none, thank you again. Okay, next we're going to hear from Ian Hewitt.
Okay, Mr. Hewitt.
Good afternoon, Madam Chair. Can you hear me?
Yes, we can.
Hi, thank you. Ian Hewitt, I'm General Counsel for Cornerstone, here to speak in support of 625 with Senator Birdsell's amendment. And I did want to note at the outset that in the House Judiciary Committee, there were 4 New Hampshire physicians that testified in support of this bill and testified that it was consistent with current standards of care, excluding there any out-of-state physicians who testified. I know at least 2 of those 4 had planned to testify today, and I know of those 2, at least 1, because we ended up being about an hour delayed, had to return to his patients. So I would just ask that the committee consult the testimony of those 4 physicians, and I'm happy to provide that, or Cornerstone can, rather than privileging one side of the debate as far as the medical community is concerned. I did want to point out there seems to be some confusion as to whether this bill passed before or after the walkout. This bill actually, I think, precipitated the walkout. This bill passed, and then the walkout happened, and then 233, which we heard earlier, was discussed. What's striking about 625, I think, is how deeply consistent it is with Roe v. Wade and subsequent cases like Planned Parenthood v. Casey. The court has consistently reiterated in all these cases that it disclaims the idea a woman has the right to abort at any reason, at any time for any reason. And I think ultimately, when you cash out the arguments that we're hearing from the other side today, that is the position of the other side. I think that's not representative of a majority of people in New Hampshire. All the data that I've seen shows when you ask people if they think abortion should be legal in all cases, only a minority of the overall population of New Hampshire agrees with that. This bill is, in fact, more modest than what Roe v. Wade allows states to do because 24 weeks is under-inclusive of viability. It's going to leave out some viable fetuses. Now, I'm struck by the fact that there's criticism of the fact that this is an arbitrary cutoff at 24 weeks, because in 2018, there was a bill in the House that would have prohibited abortion at viability, and unanimously the testimony on the other side from physicians who opposed it and others was that viability was subjective and varied from case to case, and it didn't give doctors notice of what the law is. So I think that just underscores that this isn't really about whether it's a 24-week ban or a viability ban. It's really about whether abortion must be allowed in all cases at any time for any reason. And the fact that 24 weeks is moderate, that's why we recently saw 24-week bans in many Democratic states. Massachusetts had a 24-week ban with felony penalties until December of 2020. And I just don't think it's believable to suggest that before December of last year, Massachusetts was some kind of far-right, extreme, disturbing state or obstetric desert. Nevada had a 24-week ban with felony penalties until 2019 as well. As far as the health exception in this bill, this is not an extraordinarily narrow health exception. It's the same health exception actually in our current RSA 132, our parental notification law, which has been on the books for 11 years now. And the health exception required in parental notification laws is the same exception required under late-term abortion bans, according to AOT and other Supreme Court cases. And I think I've hit my 3 minutes, but I'm happy to take any questions.
Okay, thank you very much for your testimony. Are there any questions for Mr. Hewitt? Senator Gannon.
I always get there. Thank you for taking my question, Ian. Again, it's my same question. Do I misunderstand the bill? So at 24 weeks, if a woman finds out she has a severe fatal abnormality, there's no chance at all that after birth, the child will be able to survive any length of time. Does this bill give the woman the option at 24 weeks, or is it taken away from her totally with no exception?
Well, it depends on what you mean by no exception. So I just want to clarify the scope of your question. You're asking specifically about the health of the fetus. So the
Yes.
bill does have exceptions for the mother's life
I saw them for the
and
mother,
also the mother's health. Right.
Yep,
So this
I'm
bill
there on that.
doesn't, this bill, you're right, is a 24-week ban. It draws a line at 24 weeks with those two exceptions, the mother's life and the mother's health. And before I elaborate on this a little bit, I do want to note that I forgot the name of the representative from the New Hampshire Medical Society, but I did want to note, Senator Gannon, that he didn't fully answer your question, and I can speak to that a little bit more. In 2018, in the House, there was a bill that would have banned at viability, which I just mentioned, not at 24 weeks. So that bill would have addressed your concern, and the New Hampshire Medical Society opposed that bill. There have been, for a decade, all kinds of proposed bills in the House with all kinds of cutoffs, many exceptions. The New Hampshire Medical Society has opposed every single one of them, to my knowledge, with no exception. So I think we'd still be here having the same discussion if the bill were written differently. What I would say is that, I think the argument actually that viability doesn't give people sufficient notice of what the law is has some merit. And I think that's a problem with just having viability instead of having a 24-week cutoff. This is really just how the rule of law works in the Western legal tradition, that we find a workable standard and we draw a line at a certain point. We don't, refuse to act until we've comprehensively enumerated how courts will act in every conceivable situation. That's not ordinarily how courts work. And I do think that most people in New Hampshire would say that, if, for example, you discover a lethal fetal anomaly at 38 weeks, for instance, it's not appropriate to just go in and go ahead and induce fetal demise. I do think there needs to be a cutoff where you say, at this point, we're just going to not allow abortion. And the trade-off, I think when we're considering the trade-offs, we also have to consider the consequences of maintaining the current law in New Hampshire, where abortion is allowed at any time for any reason. There would be no criminal consequences under our current law for a purely elective abortion tomorrow at 38 or 39 weeks. And we wouldn't even know if it happened because the state collects no abortion statistics.
Thank you.
Okay, are there any further questions for Mr. Hewitt? Mr. Hewitt, if you could forward that information that you spoke of to the committee, we would appreciate that.
Madam Chair, I want to make sure I specifically provide the information you're looking for. Was there a particular fact you were interested in? And I'll make sure I get that.
Yes, you had said that there were 4 physicians who had testified in support of the bill in the House. But
yes,
because of work, their work requirements today, they're not able to be here and testify. So if you have their testimony, please send it to us.
I do have the written testimony and I will forward it all to you. Thank you.
Thank you. Okay, next we're going to hear from Kayla Montgomery.
Okay, Kayla, you should be set to talk.
Thank you. Good afternoon, honorable members of the Senate Judiciary Committee. My name is Kayla Montgomery. I'm the Director of Public Affairs for Planned Parenthood, New Hampshire Action Fund, and Planned Parenthood of Northern New England, and we oppose House Bill 625. I'd like to remind the committee that there is no one-size-fits-all process when it comes to deciding if, when, or how you choose to start a family. And there is no one-size-fits-all pregnancy either. As any doctor can tell you and have told you today, every pregnancy is unique, and everyone who has experienced multiple pregnancies can confirm that these experiences can vastly differ each time. But bills like these with arbitrary bans on abortion simply cannot account for every situation because pregnancies are not predictable. Families and medical providers need to be able to make the best decisions in each circumstances and not be bound by a single policy or law. Because like you have heard today, while the need for abortion care at or around 24 weeks is not common, when it is needed, it is for complicated circumstances. And families who make these choices in these unique circumstances, they deserve our compassion and our support, not our judgment and not government interference. Bills like these politicize complex situations at the expense of both truth and compassion. The bottom line is people must have the freedom and privacy to make these decisions about their pregnancy in consultation with their doctors. The state of New Hampshire should not be in the business of policing individual personal medical decisions. And finally, I just want to quickly share Kelly's story. She lives in Concord, and a few years ago, she was pregnant with her second child. She found out later in pregnancy that her son had a fatal fetal diagnosis and would likely not survive birth. She couldn't be here today, so I just quickly want to deliver some of her story, and these are her words, and I quote, "We had to make the most difficult choice a parent can make. We thought about what would be the best, kindest thing to do for our child. We decided to terminate because it would be the kindest decision for our son, our daughter, for us. Terminating for medical reasons was the most difficult, heart-wrenching decision I've ever had to make in my life. I knew in that moment how lucky I was to have safe, local medical care and the ability to choose what would be done to me. I didn't have to go out of state for the care I needed. When it was over, I hurt just like any other parent would losing a child. Each person is different, each pregnancy is different. There's no one size fits all solution. It is critically important for women to focus on the decision that is right for her life, her baby's life, her family's life, and not have to worry about state laws that don't take into account complex medical situations, end quote. Thank you for your time today, and I respectfully ask you to oppose 625.
Thank you very much for your testimony, Ms. Montgomery. Are there any questions from the committee? Okay, seeing none, thank you again. Next, we're going to hear from Richard Johnson.
Okay. Mr. Johnson, you should be able to unmute.
There, audible?
Yes.
Yes.
My name is Dr. Richard Johnson. I'm a New Hampshire resident and hold a current New Hampshire medical license. In support of HB 625, I submit this testimony. With two decisions, Roe versus Wade and Casey versus Planned Parenthood, the Supreme Court affirmed three principles. Women have the right to abort a pre-viable fetus without undue interference from the state. Secondly, the state may restrict abortion of the post-viable fetus. And thirdly, the state has a legitimate interest in protecting both the woman's health and the life of the fetus. House Bill 625 does not violate any of these three rulings of the Supreme Court. In addition, the bill does not open the gate for a flood of legislation that would seek to criminalize medical procedures. Abortion is not a procedure that cures a disease, or except in the rarest of occasions, even saves a life. It is not the procedure that is being criminalized, it's the result of the procedure that makes it heinous. As Ost wrote in the Journal of Medical Ethics in December of 2018, it is the context that makes a given procedure a criminal offense, that is, the abortion of a viable fetus. Purposefully harming a patient makes any procedure criminal. Taking the life of a viable fetus, a baby on its way to becoming a member of our society, is not close to a procedure that removes a cancer, amputates a gangrenous foot, or removes a diseased gallbladder. This bill in no way establishes a precedent to criminalize the everyday procedures that are performed to save and improve the lives of the sick and the injured. As I said, it is not the procedure, but the results of the procedure that makes it a felony. RSA 329 made it illegal to perform partial birth abortions. Currently, it would be perfectly legal to take this baby's life before it got this far in the birthing process. The abortion, the procedure, is legal or illegal, totally dependent on where the baby is located. You and the medical profession do not need to fear that this is a stepping stone to the criminalization of medical procedures. This bill is simply following the guidance given to you by the Supreme Court to protect the life of the viable fetus. Just in parentheses, I'm a member of the New Hampshire Medical Society. I don't believe that Dr. Young, who I totally respect, is correct. The New Hampshire Medical Society does not take position on abortion officially, as far as I am aware. And as a pro-life physician, I would be very upset if it did. We allow physicians to practice their independent views with their own patients. So please don't think that the New Hampshire Medical Society is supportive of abortion per se. Thank you. I'll take any questions.
Oh, you're mute.
Thank you very much for your testimony this afternoon, Dr. Johnson. Are there any questions from the committee? Okay, seeing none, thank you very much.
You're welcome.
Next, we are going to talk to Emily Heath.
I do not see Miss Heath. Emily, if you are on the Zoom call, could you raise your hand? And if you are on the phone, you can do that by doing *9. Okay, I don't see her.
Okay, next we're going to move on to Allison Palm.
Okay. Okay, you should be able to unmute yourself, Reverend.
Hi, can you hear me?
Yes, we can.
All right, thank you. Thank you so much for letting me testify today. My name is Reverend Allison Palm. I'm a Unitarian Universalist minister serving the Unitarian Universalist Church of Nashua, as well as a resident of Nashua. And as a faith leader, I'm here to speak in opposition to House Bill 625. Unitarian Universalists have long been in support of access to safe and legal abortion because we believe deeply in the right of conscience and in the inherent worth and dignity of every person. I do not believe that it is the purpose or place of our state government to ban safe medical procedures. The only people who have the right to decide what is best for a woman during pregnancy are the woman herself with her doctor, including women faced with tragic fetal diagnoses later in pregnancy. I also believe that each woman is capable of making moral decisions related to her body and her reproduction. There are no easy answers for life's complex questions. A woman should be able to make the best decision for her own circumstance, and that includes abortion care. Each person must have the right to make these choices. Bills like House Bill 625, which threaten certain health care services, do a significant disservice to women and families in our community, and often threaten a trusting relationship between a woman and her family or her doctor. I hope you oppose this legislation and instead support bills that would make our state a safer, healthier, and better place for women and their families. Thank you.
Thank you very much for your testimony this afternoon, Reverend. Are there any questions from the committee? Okay, seeing none, thank you. Next, we'll hear from Dana Pierce.
Hello, can you hear me?
Yes, we can.
Great. Hello, my name is Dr. Dana Pierce and I live in Yarmouth, Maine. So yes, my story is that of a Mainer, but if House Bill 625 is passed in New Hampshire, my story could easily be that of any Granite State woman. Complications in pregnancy don't stop at borders. Sorry, I'm managing my 1-year-old.
That's okay.
I am a wife, a mother of 2 living children, and a veterinarian. I'm a Moorhead Cane Scholar and a world champion rower. But I'm also someone who's had an abortion later in pregnancy. On January 25th of 2019, I was 32 weeks pregnant with my son, Cameron. That morning, my husband and I, along with our 3-year-old daughter, went to what we expected to be a routine ultrasound in a normal pregnancy. And I want to take a moment to recognize that the bill sponsor and others have assured you that due to current medical capabilities, any fatal fetal anomaly could be found and confirmed by 20 weeks, or at least in time for an abortion at 24 weeks. I hadn't planned to spend my time explaining that all of the tests in my pregnancy had been normal until they weren't. I'm incredibly lucky and privileged in my access to excellent medical care. I'm incredibly lucky that I was a patient at an OB-GYN practice that conducts routine 32-week growth scans on mothers of advanced maternal age, because I was 39 at the time. In any case, during that scan at 32 weeks, we learned for the first time that Cameron had lethal skeletal dysplasia, which is the result of a random, rare genetic mutation that occurs during sperm development. And it's lethal because babies with this condition cannot breathe outside the womb. Their rib cages are too small. And there was another woman who shared that her friend found out a similar fetal diagnosis at an 18-week ultrasound. And it's a great example that every pregnancy is different and unique. Because at that time, they also realized that Cameron's femur was broken and there was evidence of multiple other healed fractures. And I emphasize again that his 20-week ultrasound was normal. In short, Cameron was sorry, he's like,
no, please, don't apologize. I think it's wonderful. So please continue.
So in short, Cameron was actively suffering and faced death by suffocation if he managed to make it to term and survive delivery. And so I can't really put into words the intensity of anguish and grief that my husband and I felt in those moments and in the days, weeks, and months that followed. I do have to emphasize that in those first few moments, my strongest thoughts were that there was no way I was going to let my son suffer any longer than he already had. Unfortunately, our grief was then compounded by the limits on abortion rights in our country. Those restrictions mean that we had to fly across the country and pay $25,000 in cash in order to end our son's suffering. And while I was incredibly fortunate to be able to afford the cost of travel, missed work and lodging and the fee for the abortion itself, the majority of women in my situation in this country and presumably in New Hampshire would not have been so lucky. Bans and limits on abortion later in pregnancy add exponentially to mothers' grief and suffering. We should instead be making laws to ensure that women facing situations like mine are guaranteed safe, compassionate care and support, ideally locally and not across the country. Ending a pregnancy for any reason is a deeply personal decision and should not have anyone involved other than the pregnant woman, her medical team, and any others that she chooses to advise her. Please join me in trusting and empowering women to make ethical, loving decisions for their own bodies. Please oppose House Bill 625. Graham and I thank you.
Thank you very much for your testimony. Are there any questions for Ms. Pierce? Senator Gannon.
You're still rowing, Dana.
I have a single hanging in my garage, but the 1-year-old kind of cramps my style.
Gotcha. Where did you row in college?
Oh, well, I went to University of North Carolina. That's where the Moorhead Kane Scholarship is. But I had rowed as on the junior national team and then on the senior national team after college. So I kind of went to Carolina for.
Thanks for your testimony today.
Yes, of course.
Thank you. Okay, thank you very much, Ms. Pierce. Okay, let's hear from Devin Chaffee.
Okay.
Thank you. Thank you so much. Thank you, Madam Chair and other honorable members of the committee. Again, my name is Devin Chaffee, and I'm the Executive Director of the American Civil Liberties Union of New Hampshire. And again, I really appreciate the opportunity to testify today in opposition to HB 625. And I want to say that I think we all know, especially after some of the heartbreaking testimony that we've all heard today, that when anyone is facing difficulties in pregnancy, the decisions that they have to make are just really difficult and they can be overwhelming. And I think we all know that patients and doctors are not making these decisions lightly or hastily. We've heard that here today, just how difficult those decisions are. I do want to quickly highlight that I think that the medical testimony, both here today, as well as in previous years, has been very consistent with regards to the fact that the bottom line is viability is nearly impossible to determine in utero. Viability differs from one pregnancy to another. It can even differ depending on the healthcare facility and the technology available. And so I think, we should all be alarmed about the possibility of restricting people's access to important healthcare based off of either an arbitrary number or a notion of viability that is just impossible to determine. Secondly, I just want to focus on the fact that HB 625 has an incredibly limited exception here. If you look at HB 625 and you look at the definitions, really it only allows for an abortion after 24 weeks to avert the pregnant woman's death or serious risk of substantial and irreversible impairment of a major bodily function of the pregnant woman. This is a very narrow exception, and this exception excludes abortion services that might be necessary for the health of the pregnant person as determined by the patient and their doctor. And here I want to take issue with some of the previous testimony in that I believe that this narrow exception raises serious constitutional concerns. If you look at the US Supreme Court precedent, not only in Roe, but also in Casey and Doe v. Bolton, there are serious constitutional concerns that come out of the very limited nature of the exception that is outlined in HB 625. I mean, the bottom line here is when complications develop in a pregnancy, a woman needs to get the care that she needs. And in addition to being potentially unconstitutional, it's just callous to impose one rule on every single woman, regardless of what the circumstances that she's facing. So because of that, I would urge the members of this committee to trust physicians and their patients to make the best decision and to deem HB 625 inexpedient to legislate. Thank you so much.
Thank you very much for your testimony this afternoon. Are there any questions? Seeing none, thank you again. Next, we're going to hear from Dr. Dibble.
I do not see Dr. Dibble.
Okay. How about if we move on to Sarah Wild?
Okay. Sarah Wild, if you are on the Zoom call, could you please raise your hand, either on the computer or if you're on the phone, dial *9. I don't believe she's on the call.
Okay, let's go to Jason Hennessy.
Okay.
All right, can you guys hear me?
Yes, we sure can, Mr. Hennessy.
Wonderful. Hi, my name is Jason Hennessy. I'm the president of New Hampshire Right to Life, New Hampshire's largest organization focusing on just life. New Hampshire Right to Life supports HB 625 as introduced. I'd like to ask the committee members to consider two questions. The first one is, who is a person? And the second one is, what protections do those persons deserve? Most of the great human atrocities that you can think of happen when its society gets one or both of these questions wrong. So on that question of who is a person, do you think that that definition should depend on someone's choice based on a crime committed before they were conceived, whether someone else thinks that their life is worth living? And I'll give you two data points to think about this with. The first one is that the Guttmacher Institute, an organization that advocates for abortion, says that 43 states have some restrictions on late-term abortion. Another data point is that a poll as recently as 2019 showed that about 80% of Americans agree that late-term abortion should not be allowed. This reflects a broad consensus across America that these unborn babies are considered persons who deserve protection. And if we agree that an unborn child at 24 weeks is a person, then that child deserves society's protections. House Bill 625 introduces that. I wanted to address a couple of things that I heard. Addressing the question on whether late-term abortions happen in New Hampshire. I'll note that it's very difficult to tell. None of the people who testified that they think that they don't occur, or at least in elective late-term abortions occur, have universal knowledge of everything that happens in New Hampshire. In New Hampshire, we're very independent. We don't talk a lot, and so the bills that would have introduced statistics that would have given these to us, this knowledge, they aren't there. So the other thing I'd like to address is the recruiting issue. I think the people who testified that adopting a late-term abortion ban have it backwards. Given that 43 states have late-term protections for the unborn and 80% of Americans disagree with this practice, New Hampshire might actually be able to attract and retain more doctors with a less extreme abortion stance. It seems like only the hospitals that have extreme views on abortion might have trouble. In fact, I had a friend who was a graduating medical student who specifically excluded Dartmouth for her residency because of their abortion stance, and I don't think she was alone. So the recruiting issue is not a general problem, especially for the many hospitals in New Hampshire that do not perform abortions. And with that, I'm all set. And if you guys would like to ask any questions, I'd love to take them.
Thank you very much for your testimony, Mr. Hennessy. Are there any questions from the committee? Okay, seeing none, thank you. Next, we're going to go to Kelly Potenza.
Kelly, you should be able to unmute.
Yes, hi. I won't yield my time this time. So first I'd like to piggyback on that as well. It seems as if we're getting all of this testimony from a very small percentage of everyone that works at Dartmouth Hitchcock that is supposed to be, loving babies and children and families. And it's so disturbing that we literally are focusing on absolutely rare cases and using that as kind of like, in a sense, the norm. Also, extremely disturbing about listening to Planned Parenthood calling these things arbitrary, and when they're in the business of abortion and and selling body parts. So I'd like to talk just about one thing that this was several years ago, and it just talks about how babies, and I believe that 24 weeks is way too far along. It should be 20 weeks gestation. There's been tons of research that's been done. I'm sending it all to you so you can have this, but you know, we're going to take what we can get in New Hampshire. But two former abortion industry workers, very famous, I'm sure you've heard of them, Stanek, a former registered nurse, Anthony Livatino, he's a former abortionist, as well as Kondik, a PhD neurobiologist, all spoke, you know, on the House in the U.S., excuse me, in the U.S. Congress on all of these things. But, you know, I have to say that they all know that babies feel pain. And I think that's what we need to know. They have proven this. They know that babies can feel pain in 8 weeks of life. And to say when Levatino testified, who performed more than 1,200 abortions, he described in graphic terms that role of the abortionist. Picture yourself reaching in with a sofa clamp and grasping anything you can. At 24 weeks of gestation, the uterus is thin and soft, so be careful not to perforate or puncture the walls. Once you have grasped something inside, squeeze on the clamp to set the jaws and pull hard, really hard. You feel something let go, and out pops a fully formed leg about 6 inches long. Reach in again and grasp whatever you can. Set the jaw and pull really hard once again, and out pops an arm about the same length. Reach in again and again in that clamp and tear out the spine, the intestines, the heart, and the lungs. The head of the baby that age is about the size of a large plum and is now free floating inside the uterine cavity. You can be pretty sure you have hold of it. The sofa clamp is spread about as far as your fingers will allow. You will know you have it right when you crush down on the clamp and see white galactaceous material coming through the cervix. That was the baby's brains. You can then extract the skull pieces. Many times a little face will come out and stare back at you.
Senator Carson, I'm sorry, that's 3 minutes.
Yeah, so I think that's all you really need to hear. This isn't about rare cases. Make it happen, New Hampshire.
Okay, thank you very much for your testimony, Ms. Potenza. Are there any questions? Okay, seeing none, thank you again. The chair will call Chow Kelly.
You should be able to unmute yourself. Chow Kelly.
Hello.
Hello.
Can you hear me?
Yes, we can hear you.
Okay, let me walk out this room, excuse me. Thank you for taking my call. I'm calling because I don't know if you guys know the famous opera singer, Andrea Bocelli. His story was that his mom, when she was pregnant, doctors told her that she should have an abortion because he has many problems if he's born to this life. But his mother, didn't listen to the doctor. And that's how we had this wonderful opera singer to contribute to the world. And for me personally, I went through this process myself. I had a stillborn, and I knew about my baby heart condition just a couple weeks, when I was pregnant, just a couple weeks. And yes, doctor, gave us options and stuff like that. But we believe in God, and we believe only God can take life. And babies are a gift from God. And however long and whatever the babies and the mothers going through is in God's plan. So we should not take life, period. And it's surprising to me that spiritual leader, that pastor and all these people call themselves spiritual. But the basic thing is not to take life, and they're supporting it. This is ridiculous, So, the babies feel pain, yes. Baby cannot talk. Mother and doctor making decision. But did they ask the baby? Would the baby want to stay a bit longer inside mother's womb just to feel that connection? So, nobody asked what the baby wants, how the baby feels, because it cannot talk. But that is the weakest, defenseless citizens of America and of this world. So be humane. You wouldn't kill a dog or a cat because you call it a dog or a cat, but a human being inside a womb, a mother's womb, is called a fetus. So it's called an it. So you can do whatever with an it, but that is a human. So let's not kill any human being. We don't kill dogs and cats, so please do not kill babies. Let it take its own term. When it's time, it's time. It's up to God. No mother should even have that right to do that. It's not her choice. It's God's choice. You know? So that is what I believe that we should do as a human being, not just a politician, a doctor, a mother, whatever. As a human being, protect lives, save lives, especially the future leaders of our country. These citizens, they might be born with disability, but they can be great human beings. Thank you.
Thank you very much for your testimony, Ms. Kelly. Are there any questions for Ms. Kelly? Seeing none, thank you.
Thank you. I support it, of course. Thank you.
Thank you. Next, we'll hear from Kelsey Wilson.
And I don't believe Kelsey Wilson is on the call any longer, Senator Carson.
Okay, let's hear from Dr. Peter Kiprop.
Yes.
Hello, I would like to thank the chair and the committee members for giving me this chance. My name is Dr. Peter Kiprop. I'm a family medicine and also do obstetrics. I'm a resident of Manchester, New Hampshire, and I've been practicing for the last 12 years. And I'm testifying in support of HB 625. I think this is a very reasonable bill in support of fetal life. We know that after 24 weeks gestation, the survival rate of the fetus outside the womb is significantly higher as compared to any time before this gestational period. I distinctively remember around 8 years ago, I was involved in the care of a patient who had to be delivered at around 25 weeks gestation due to severe complication of her pregnancy. A newborn baby girl was delivered. She had to spend a long time in the intensive care unit, but she was eventually discharged, and now she's a gorgeous 8-year-old girl who is thriving both academically and physically. So, honorable members, I think the lives of these children will depend on how you vote. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you again for your testimony. Next, we will hear from Rachel Yared.
Okay. Rachel, if you are on the call, could you please raise your hand? Or if you are on the phone, dial *9. I don't believe Rachel's on the call any longer, Senator Carson.
Okay, let's go to Caitlin G.
Caitlin, same thing. If you are on the call, could you please raise your hand? And if you are on the phone, you can do that by pressing *9. She's not on the call as well.
Okay, let's try Alyssa True.
Alyssa, if you are on the call, could you please raise your hand or press *9 if you are on the phone? Alyssa is not there.
Okay, are there folks in the waiting room?
There is one hand raised. I believe it's Dr. Hewitt or Ian Hewitt would like to speak again.
Okay, all right, let's hear from him for one last time.
Okay.
Thank you. Only Attorney Hewitt. Thank God I don't have an MD as well. That was enough graduate school for me. I did just want to respond to something new that came up, which was the constitutionality of the health exception. And I'll just make 3 quick points I'd like to point you to. One was the health exception discussed and upheld in Planned Parenthood v. Casey itself, which the ACLU cited to you. In Planned Parenthood v. Casey, the court looked at an abortion statute that had this health exception. serious risk of substantial and irreversible impairment of a major bodily function. That may sound familiar to you because that's the exception that's in this bill. Again, in AOT, which was the case that struck down our previous parental notification statute before the current one, there, Justice O'Connor, writing for the majority, said, the problem with the bill is that it had a life exception, but it didn't have an exception for serious and irreversible damage to a mother's health. So that's the kind of health exception Justice O'Connor had in mind as constitutionally required. She was far from a far right, anti-abortion extremist. And then the last example I want to point you all to is, again, the health exception in our current parental notification law, RSA 132, which has been on the books for 11 years. That's where this health exception is taken from. And I want to point out in particular that the court has repeatedly said, including in Stenberg against Carhart, that if a law applies before the point of viability, the court's going to be much stricter on that law constitutionally. So what that means is that laws like our parental notification law that apply at any time throughout pregnancy, if one of those were to be challenged, the court would be much stricter on it than it would be on this law, which is under inclusive of viability. So I think, in fact, the ACLU knows that this health exception is probably fine, and that's why our current parental notification law and its health exception have not been challenged by the ACLU, and that's been on the books for 11 years. Again, if the key here is if the ACLU were to challenge the health exception in the current parental notification law, as opposed to challenging the one in 625, it would have an easier time winning because the courts have said if it applies before viability, we're going to be stricter on it and stricter in enforcing the health exception. Thank you. And if there are further questions on that, I'm happy to answer them.
Okay, thank you very much. Are there any questions for Mr. Hewitt? Okay, seeing none, thank you very much. Tricia, I think that's probably it.
So sorry, Senator, Dr. Young has been trying to raise his hand, but is having a couple problems doing so.
Dr. Young?
Yes.
All right.
Okay, this is the last person we're going to hear from.
Okay.
Because we're not going to do this back and forth. If there's new information, that's great. But yeah, let's put him through.
I'll be very brief. I testified that I was representing the New Hampshire Medical Society, which is opposed to both of these bills. But in previous testimony by Dr. Johnson, he suggested that I was claiming that the New Hampshire Medical Society supports abortion. That's very different than what we support. We support the privacy of the physician-patient relationship, the same position as the American Medical Society, the same position that the Judge Blackmun took in Roe v. Wade in 1973. The abortion law was passed because it allowed for the privacy of a physician-patient relationship, and that is why the New Hampshire Medical Society opposes both of these bills.
Okay, thank you very much for that clarification, Dr. Young. Tricia, I take it that that's it.
That is it.
So
Senator.
I am going to go ahead and close House Bill 625. Okay, that is all of our work that we're going to be doing today. I want to thank all of you for hanging in there. It's been a long afternoon. And I will take a motion to adjourn our meeting today.
So moved.
Okay, Senator Gannon moved and seconded by Senator Khan. Okay, I will call the roll. Senator Gannon?
Yes.
Senator Whitley?
Yes.
Senator French?
Yes.
Senator Khan?
Yes.
And Senator Carson? Yes. Thank you all very much.
No, thank you. That was wonderful. Great job. Good job, Senator.
You always surprise me, Senator French. Well, it's important that we hear from everyone who would like to speak to us
For sure.
and give us their opinion. I think that's very, very important. So again, thank you all very much. And I look forward to seeing you all on Thursday. So everybody have a great evening.
Okay.
Take care. Bye-bye.